everybody to the Littleton Board of Health Monday, August 30th, 2021 Zoom meeting. Just want to thank everybody. It's a busy time, and thank both boards for joining us tonight. The purpose of the meeting, of this joint meeting, is to review and discuss a proposed indoor facial covering mandate. And I want to thank the board of the select board for joining us tonight. Is Chuck here tonight?
He's, I don't see him yet, but he should be on. Couple minutes, Lisa.
So does the I guess the select board needs to
He's
open.
in the. Sorry, Chuck's an attendee. If someone could elevate him.
And Cindy's logging in now too. Okay, Lisa, I think you're all set.
Okay, so we're just waiting for Chuck to open the select board.
All right, I call the select board meeting of August 30th to order.
Great. So first, what I wanted to do is just introduce right now Alexandra Rubin, who is town council, and she is going to help us guide us through options.
That's some kind of introduction, Alexandra.
Woo, Alexandra. So she's here to help us with some options for the draft order or regulation regarding indoor mask mandates. So we wanted to switch things up a little bit tonight and start with public comments first. So you have people that are calling in or called upon. Please state your name and address. You'll be given 2 minutes to speak, which will be timed by our administrator, and after which you will be muted. As just a reminder to everybody that's calling in, the board members are volunteers, and we expect a polite and respectful discussion tonight during public comments, and otherwise we won't tolerate bad behavior tonight. So thank you. All right, Janet.
Justin Keene.
So Justin, state your name and address, please, and you have 2 minutes.
Justin, you need to unmute yourself, please.
Sorry about that. Can you hear me?
Yes.
Fantastic. Thank you. Justin Keene, 56 Shaker Lane. Good evening. I'm the owner of Woodshed Strength and Conditioning, a private coaching facility which operates at 53 Ayer Road. We've been in business in Littleton since January 2011, and it's been a wonderful 10 years in town. We're proud to have served so many of our town's residents and families, to employ several Littleton residents amongst our small coaching staff, and during this last uncertain year, we're proudest of keeping our clients and coaches safe. Since we reopened for indoor classes in July of 2020, we've accommodated over 12,000 gym visits for our members with zero COVID spread. As you debate a mask mandate for indoor public spaces, I'd like to briefly share the perspective of a small business owner in the health and wellness industry and ask that you consider not enacting this order. From an existential perspective, I'm concerned that a business like ours, whose mission is the type of improved health and wellness we know to positively affect COVID outcomes, might not survive a mandate, which essentially invites our members to put their memberships on hold in order to travel one town over and exercise without a mask. We certainly aren't counting on continued federal or state aid to bridge this gap, but in our business, once you leave a gym to find a new spot, you don't usually come back. Less than 5% of the members who paused their memberships with us during the shutdown last year have returned, and for a small local business like ours, that is devastating. However, I would not ask that you consider a request if I weren't confident that our business was able to function differently yet safely within our current climate without masking. Ours is a 5,300 square foot members only facility. We control entrance and egress at all times. We control attendance as all of our traffic is appointment only. We are able to keep our garage doors open and exhaust fans running during workouts so that our air quality is commensurate with an outdoor space according to our carbon dioxide detectors. And we know very well every single person who comes and goes on a daily basis. We know anecdotally that ours is an incredibly high vaccination percentage, and we are well able to stagger and stage workouts, people, and sessions accordingly. Given this data, I believe our business.
Thank you, Justin. We have a 2-minute limit because of the number of people that are in the audience tonight. So thank you for your comments.
Ina Landsman, if you could unmute.
Hi, Ina Landsman from 27 Lawrence Street. I'm asking the boards to enact a mandate. As we all know, Delta is way more transmissible than others. We know that in other states where they have high transmission, we know young children are getting sick in some states. The pediatric ICUs are full, there is no room. And I think we should care about it because we care about our elderly, or those, some people who have vaccinations can still get breakthrough infections and transmit it to others. And our children have no choice. They need to go to school. They have no control over who they sit next to and how careful the families are. And in terms of local businesses, I desperately want to support local businesses, but the choice we have made is that we will not go into most unmasked businesses. And because if that means risking our child's health, and it's not just me. So, we could put our heads in the sand and our numbers will go up, up, up. But then, workers are going to have to quarantine, and that's not good for business. And do we think that people from other towns will say, gee, I want to go to Littleton. I know they have high infection rates, but I'd rather put my family in danger. No, that's not what's going to happen. So as numbers go up, we may have no choice but to have remote school, where there may be occupancy limits, and we may have no choice in any of that. So the bottom line is we need to keep transmission low to keep life as normal as possible. So if we care about our children's health, if we care about Littleton businesses, if we care about the freedom to go to school, the freedom to operate in businesses as normally as possible, then a mandate is the right decision. Thank you.
Thank you, Ina.
Janet, thank you for holding that up to give people kind of the 20-second warning.
I don't have any other hands raised at this time.
That's it for public comment.
Oh, somebody else, I'm sorry. Deb Carlson, if you would unmute and state your name and address, please.
Hi, my name is Deborah Carlson, and I am the owner and operator of Salute Wine Bar at The Point. I have been in business during the pandemic, and I've not been eligible for any federal funding. A mask mandate is going to hurt my business. We have just started doing entertainment. We are seeing a slowdown in business, definitely. We don't usually have children come in because we are a bar. I understand how masks can help, and I understand how children are unsafe because they are not eligible for the vaccine. But I don't think that the mask mandate is the way to go. I think better education to get more people vaccinated is the way to go. I know you had the Vax Bus, but I didn't see much advertisement for that or much education towards that. I do hear a lot of people who are nervous about the vaccine because they don't really know what it's all about. I just think that a mask mandate is just going to push people, as Justin was saying, I think it was Justin or Jason from the gym, as he was saying, that's going to push them to other towns, which means businesses in Littleton are going to see a huge decline. As people go to Acton or go to Westford who don't have mask mandates. I really understand how nervous people are, but I think that the way to go is to educate and get more people vaccinated and not to impose restrictions on the businesses who are suffering as it is. Thank you.
Thank you.
Cleo?
Hi, this is Cleo Rourke at 100 Whitcomb, and I really like to reiterate, as I have done in emails, that the science by the CDC as well as the American Pediatrics Association is clear. Whether you're vaccinated is not protecting others from getting sick from you, meaning you can still spread the disease when you're vaccinated. And many of our children, especially the young children, can't even get vaccinated. So I just think we are really putting their health at risk over a minor inconvenience that is a mask. I can understand some businesses struggling. The person who spoke earlier, it's great that they can provide outdoor-like conditions. I doubt that any other businesses can do that. And I also doubt that people are going to drive towns over only because they do not have to wear a mask when working out or buying something. I mean, I don't think that's realistic. I think people will go to the stores they always go. I mean, nobody stopped going to Market Basket. Wearing a mask was required for the safety of everyone working there. And I just think, sorry to be passionate about this, but I think it's irresponsible to put other people's health at risk because we cannot have a piece of cloth in front of our face for a couple of hours. Thank you.
Thank you.
Brian Tarbox, excuse me.
Okay. Brian Tarbox, 16 Fletcher Lane. I've got a master's in laboratory science. I've got 10 patents, and I work at a company that does cancer genomics, just as background. I've heard some board members talk about personal freedom as a reason not to have the mask. I think members should understand that community means shared responsibility. We all have to have some restrictions upon our behavior to be part of community. And it's great to be in a country that values individualism so much, but we are supposed to be a community. That's what one of the things we treasure about the town. And that community means taking care of each other. I'll point out that people who are dead or intubated don't go to local businesses. And I think it's crazy that we're even needing to have this discussion. It's been pointed out, and people have said, oh, let's just have more education. Well, how about education about the fact that even vaccinated people can transmit the virus? So even if we had higher levels of vaccination, we would still need the mask. I beg you to leave this decision in the hands of the scientists, and with all due respect to the Board of Selectmen, this decision should be made by the Board of Health only. Thank you.
Thank you.
Charles Howe, if you could unmute yourself, please.
Charles Howe, 564 Newtown Road. I just want to bring up a couple things. I was at the prior meeting last Wednesday and listened to some of the comments from the boards. I can't remember who the board member was in the Board of Health, stated that you were not allowed to enter CVS in town without a mask. That is incorrect. I went to CVS today. People who walk around without masks. CDS's policy is they're following the CDC guideline, which is they recommend anybody vaccinated or not vaccinated to wear a mask. So they are not requiring everybody to walk in there with a mask on. The other thing that was brought up the last meeting was that there was going to be no type of fines or anything brought up if people do not follow it. So if you're going to make a mask mandate without any thing behind it to, penalize people for not following it, it's almost like you're just making a recommendation. So I don't know if you were trying to talk a mandate or a recommendation, but if you're going to do a mandate, you have to have some type of fines involved with it, or you're really just saying to the businesses that, oh yeah, you have to have people wear masks, and people doesn't wear a mask, we're not going to worry about because we're not going to do anything. So that is my input for today. Thank you.
Thank you.
John Kay, could you unmute yourself, please?
Yeah, John Kurzwick, 171 Hartwell Avenue. Part of decision-making process, I think, requires, a core set of facts. And, I've heard these debates now off and on over the last 18 months. And a couple of callers so far, they've said, what about the children? The children, my God, the children. Ladies and gentlemen, can we stipulate a fact here? Because the kids are not at risk of COVID. I got the data. This is from New York Times, so they're not some alt-right, news source or whatever. They've got COVID death rates 2 per million from 1 to 4, and 2 per million 5 to 14. That's under vehicle accidents, homicides, cancers, flu and pneumonia, which is 8 per million actually. The kids are not at risk of COVID, okay? It is below influenza when you look at the total annual risk. CDC stat right now, over the last 18 months, it's 350 kids have passed away. It's tragic, but that is less than the annual risk from the previous 2017, 2018 year influenza. So the kids, I'm sorry, that's not the problem. Okay. The other issue I have is when it comes to the efficacy of the masks. We've been going back and forth. So I'm gonna put some data out there. So people have been saying, let's use the mask for source control. Well,
I guess John went past the 2 minutes. So sorry, John. That's how we started the meeting. So next. Margot Bloomstein, can you state your name and address?
Sure. It's Margot Bloomstein. I live at 7 Wilson Lane. I just wanted to first respond to the pseudoscience that we just heard. Many of those numbers were incorrect. And as someone that does have a child in the community, I won't say, oh, the kids. Death rates may be what they are, but we also are seeing more and more about the long-term effects of COVID. I don't think anybody wants that either. And if we have the opportunity to mitigate those effects and the number of people in our community that get them, I think that we should take that opportunity, especially because I would counter as both a parent and a consumer of many businesses and restaurants and shops in the community. When I see businesses that are more stringent about masking, when they're restaurants that are encouraging their patrons to mask up for the safety of the people that work there, and that then encourage the wait staff to mask up, or when I see small businesses that have a sign that says, actually, masks are required here, I try to go out of my way to thank the manager and say, this makes it feel safer for me, for my kid, and just me and my husband who aren't kids to come in, because we do know, we can read the science, we can see the value and impact of masking. So I would say, as kind of a counter argument to people that are saying it's bad for business, masking up is good for business. It is good business for larger companies that have initiated mask mandates, as well as small businesses. But what I would say, I think there's a real opportunity for civic responsibility here, that the board should mandate a mask mandate. The board should put in place a mask mandate rather than put it on the shoulders of small businesses, so that individual business owners and store clerks and wait staff don't have to be the ones to say, hey, you're supposed to have on a mask. It shouldn't be on their shoulders. I think there's a real opportunity for Littleton to lead the way locally, because as we've seen.
Okay, sorry, Margot, we have a 2-minute limit for all the comments.
Rebecca Lewis.
Thank you. Rebecca Lewis, 166 Harvard Road. And I also want to urge the boards to put in a mask mandate. I would counter some of the previous arguments. I know that there are places that can safely do business without masks, but I personally choose to, and know many other families, choose not to go to any businesses that won't require masks. And we see people increasingly refusing to wear them, not wearing them. Means that our Delta numbers are going up. And I also want to counteract the false or pseudoscience that was presented. The nation's children's hospitals, the CEOs and executive directors this week actually released a call to protect our children's nation's children's hospitals, which I'm sure the boards are familiar with, but other callers may not be, where they're saying there is a real looming challenge with our hospitals, children's hospitals specifically, because of the rise in COVID infections, as well as other respiratory illnesses such as RSV, and the mental health impact on our nation's children health workers. So I just want to reiterate that request for imposing the mandate.
Great, thank you, Rebecca. And just a reminder to the people with their hands up, it's a 2-minute warning, or 2 minutes for your comment. If you look at Janet Fairchild, she's holding up her phone with the time left. So usually about 20 seconds or so to wrap it up. So, all right.
Yes, I'd also like to follow up on John earlier. So you can go to the cdc.gov website right now, and their recommendation clearly is masking up indoors.
Hasn't she already spoken?
Right. Yes, I have. I was invited. I figured I'd try to raise my hand. I wasn't aware that if I am being unmuted, I am not able to speak. I can stop speaking. I'm totally fine with only one. But I was just gonna say you can go to the cdc.gov website.
Thank you, Theo. Thank you.
Sorry, that was my fault. I was taking in order instead of. Let's see. Danielle Fryer, if you could unmute.
Yes. Hi, Danielle Fryer, 55 Taylor Street. I would like you to please do I want us to be masked in town. I have a niece who works at Children's Hospital, and there is definitely an increase in children being vulnerable. Not just children, but as others have said, we need to think of this as a community. We need to protect one another. It may affect local businesses, it may not. We're just going to have to see how it goes. It's not going to be long with the way that the Delta numbers are going that it's going to affect other towns. Acton, Westford, towns around us, everybody's going to be following the mask mandate. We have to protect one another, and all the towns are going to be following this, not just Littleton. Whether we start with a mask mandate, whether we finish, it's going to be all the local towns, and everybody's going to be doing it. And we just need to protect one another, not just the kids, but the elderly, the vulnerable, everybody. So I'm asking you to please, medical professionals on the Board of Health, everybody, just not just think of the numbers, but just think of everybody. This is something that needs to be done. It needs to be put into place. It's a shame that it couldn't be done last week, but I understand we need to do things properly with the paper trail and legally. And I'm asking you to please do the right thing tonight for everybody. Thank you.
Thank you, Danielle.
Thank you.
I'm sorry, could I interject for just 1 second? I hear from an audience member that because the view is not gallery view, the speakers can't see Janet holding up her timer. So perhaps we could just do a verbal warning about 20 seconds left so that people don't get cut off in mid-sentence.
Okay. Can that be changed or no? Gallery view?
On their individual, they would have to do it on their computers.
Maybe Janet could just do an audible.
Yeah, I'll do an audible at 20 seconds. Seth Landsman, you're up next.
Thank you. Good evening. My name is Seth Landsman. I'm at 27 Lawrence Street. The science is pretty compelling. Mask mandates do help. Temporary mask mandates can help us get ahead of the spread, and will simply keep people alive. We'll keep our children alive. We'll keep those who cannot be vaccinated alive. Absolutely, we should increase our vaccination rates. Absolutely, everyone eligible should be vaccinated, but not everyone can be vaccinated right now. The Delta variant is spreading faster, is more infectious, and will have a higher impact in our community. Given the science, given what we're seeing in other towns that have imposed mask mandates, it will reduce the spread. That the science is pretty clear. Thank you.
Thank you, Seth.
Mike, you can unmute.
Hi, thanks. I don't expect this to be answered now, but over the course of the conversations that result from all these comments, I'd just like to know what the criteria will be going forward for the mask mandate to be removed, I guess. We've gone all summer without a mask mandate. I understand the numbers are rising now. They didn't throughout the summer for a variety of reasons, but I think that the residents should be able to understand where we need to be, where we need to get to in order to take the mask mandate back. I mean, I think it's pretty clear that's going to happen tonight. So I think we're owed that at least as part of this conversation. The other question I have is, I know the Board of Education or the DESE, or I think that's what it is, said, or maybe it was just the Education Commissioner said, October 1st, they're going to revisit masking in schools. So I guess my question is, and I think I know the answer, but I'd like it to be spelled out clearly by the Board of Health. If on October 1st they rescind that mask mandate in schools, will you abide by that, or will you supersede that? Or I don't know if that's the right word, or I think you know what I mean, though. So I'd like to know that. I am worried about our kids in schools with masks on for 8 hours a day. I think, I do agree that it is, part of the Swiss cheese model that masks are helpful, but I don't think it's a zero-sum game. There is no science that, talks about the long-term effects of our children wearing masks for 6, 7, 8 hours a day if they're in after-school programs or whatnot. The reality is they are breathing more carbon dioxide than they've ever breathed in their lives. The notion that we're confident that there's no long-term effects because of that is, there's nothing to base that on. So I am worried about that. I'm worried about the children more than the rest of the town. So thank you.
Can we get Mike's address?
83 Mill Road.
Thank you.
Thanks, Chuck.
Allison McCarthy, you can unmute.
Hi, this is actually Justin McCarthy, 7 Stony Stream Lane. I just wanted to reiterate some of the points made by some of the earliest business owners that didn't have the opportunity to finish their comments. I do think you are picking on a small number of businesses within this community, largely the gyms and the restaurants, and I don't think it's fair that they're going to suffer gross revenue. As you've heard from 2 individuals this evening, they barely made it through, and here we are again hurting their businesses when they have the people that wish to patronize their businesses, are doing so willingly. Those that want to mask can mask. By instituting a mask mandate, you are essentially putting masks on individuals that either feel that they don't have to wear a mask or they don't want to wear a mask. And that's going to impact the bottom line of these businesses. Number two, I have a question about the January 12th date in the proposed motion. I think that's way too long for the Board of Health or the Select Board to be considering. I think you folks owe it to the community to get back to the table quite regularly to debate or discuss this. And then lastly, to follow up on the last caller, as it relates to DESE, I would like to hear from the board prior to you voting this. If DESE drops their mandate October 1st, what's going to happen with this proposal as it relates to the school system? Thank you very much.
Thanks, Justin.
Erica, you can unmute.
Erica Podgorny, 6 Fox Lane. I'd like to speak in favor of a mask mandate. A couple points that I wanted to bring up. First, there's a lot of talk about if you want to wear a mask, wear a mask. I think it's pretty clear at this point, we've been doing this long enough, that I wear my mask to protect you. My mask does not do as much to protect me as it does to protect others from me in case I might be carrying it unknowingly. So just saying that, oh, well, if you want to wear a mask, you can, but that doesn't protect me. The other thing I wanted to bring up is about the idea of personal liberties. And this is not a matter of personal liberties. There are so many things that we put in place as a community, as governments, that limit our freedoms in order to protect safety and public health. We have to wear seat belts, even though that's only about protecting you, right? You can't go out and speed. You can't go out and drink and drive. There are things in place to keep the public safe. This is something that we can do to keep the public safe. There are people who can't be vaccinated. There are young children, there are immunocompromised people who cannot be vaccinated. And it is our job to take care of our community and watch out for everyone in the community. Thank you for your time.
Thanks, Erica.
Eileen, you can unmute.
Hi, it's Eileen Wiedegardner from Maplehurst Road. First, I want to say I applaud the town for the vaccine rates, and I applaud the board for getting the vaccine bus out there, or the town in general. And I applaud the people who are working towards keeping everyone safe. I want to reference Dr. Clungy's comments at the select board meeting, where he noted that this could not be left to the schools alone. I agree with him there. With the rate of infection for Delta being 8-fold and the rate of transmission in other communities, we can expect to see more breakthrough infections where those who are unaware that they are infected are spreading it to others because they've already been vaccinated. With that, I also feel for small business owners. I wonder if the town could examine a way we can implement a mandate that gets masks anywhere that may be through an attestation or guarantee for ventilation, distance, and vax status of their clientele. I would also love to know if there are any ties that we can take to vaccination rates of the community, maybe even boosters, community transmission rates, and other public health data to either lift or put in a mask mandate for the people. I do want to see the people in the community safe. And I would also love to know what the Board of Health and the Select Board know about surrounding communities who have also implemented mandates. I know Boston has one. I think Harvard has one. So I'm curious to know about what our experts who have been elected to boards know about what other communities and surrounding towns are doing. Because
20 seconds.
If Air has a mandate, no one's going to go over there to go exercise. So I just want to know that we can come up with realistic answers to a problem that is with us. Thank you.
Thank you, Eileen.
Matthew Ridge, you can unmute.
Matthew Ridge, 325 Great Road. I have a quick question. I was a little bit late to this meeting. What was the number for COVID that are making us worry about it being putting a mask mandate back on board again?
We did not discuss that at the beginning of the meeting.
Okay.
We
Well,
discussed it at our regular meetings. This is a joint meeting with the school, with the select board.
okay. Well, here's the thing. I know the number, and it's minuscule. It's to the point where it's almost in double. It's barely over double digits. Now, I'm not going to tell you the number because you won't let it out. So we'll leave it at that. Here's the thing. We are in Massachusetts. We are in gray. That means we are not even at a risk. And this is with the latest COVID numbers from Massachusetts, with them actually doing the COVID per every week or every 2 weeks. I pulled the data last night, and that's why I know this. On top of that, if we are going to be masking up again, I don't see the logic behind it. I'm sorry, but we have been masking and unmasking without logic or reason.
20 seconds.
We mask for restaurants to go in, but we don't mask when we're sitting down. Where's the logic? We need something, and this is not where we're going to do it. And I would suggest strongly not to put the mask mandate back up because we've gone all summer without it.
You.
Catherine, you can unmute.
Hi, Catherine Kristofik, 190 Hartwell Avenue. I request that the Board of Health vote to implement a mask mandate. The Delta variant is far more contagious than previous variants. This is science. It is spreading much faster than any previous variants. Vaccinations prevent severe disease in individuals, but masking has been proven to prevent the spread. I am personally vaccinated, but I could have a case unknown to me and spread it to somebody else. This is how this variant is spread. I would like to see businesses have this mask mandate so that I can go to the grocery store and CVS and all of these necessary places that I choose to go to. And I would ask that the Board of Health make this call. And I would ask that the Select Board defer to the Board of Health decision as they are the health agents for the town of Littleton. Thank you very much.
Thank you. All right, if that's all the questions, I think we're going to have Anthony, correct me if I'm wrong, are we going to have Alex explain to us the draft order now, or are we going to have this board discussion?
Yeah, so Alex can explain, the first thing she can explain is the options that are available to both boards, and then she can get into the draft that she prepared for both boards to review.
Or let me propose, did we want to have some discussion prior to that, as we discussed earlier, or?
That's what I'm just wondering, whether it's Alex, we should have board discussion or Alex.
Chuck, do you want to at least to get into the options available, or do you think that?
I think the options is a good idea. I wouldn't necessarily. I think
maybe the options then.
Yeah, it's going to happen organically.
Right. So maybe Alex, the options that are available would be great.
Thank you, Alex.
Sure. So there are essentially two options here. Option one is to do a joint.
Alex, will you just identify yourself and from where you're calling from and what your credentials? Thank you.
I'm Alexandra Rubin. I'm an attorney with Miaris and Harrington, which is town council for the town. My background is my credentials. I was Deputy General Counsel at the Massachusetts Department of Public Health for 6 years prior to joining Miaris and Harrington. And when I was at DPH, I was the attorney in charge of emergency preparedness for the state. So it was a very interesting situation having this pandemic happen shortly after I joined the firm. And seeing it from the municipal side as opposed to the state side. So this was kind of in my wheelhouse, helping the towns and our clients weather the pandemic. I say that because I have a familiarity with the statutes and regulations and various things in Massachusetts that govern these types of actions by municipalities. And essentially, the town has two options. Option number one would be a joint order between the Board of Health and the Select Board. The chapter and verse for that is Chapter 111, Section 104, which allows the boards together to take action that they see fit to prevent the spread of essentially an infectious disease in the town. That's my personal preference. I find it cleaner. I find legal authority to be super clear. My understanding is that a number of towns in the state have done these under Section 104, so a joint order between the between the Select Board and the Board of Health. If for some reason there isn't a joint order, the Select Board can't get quorum, the two boards can't agree on a particular, statement within the order, then the Board of Health can proceed on its own. They would proceed via a regulation. The chapter and verse for that is Chapter 111, Section 31. And the Board of Health could essentially pass a mask mandate as a regulation of the Board of Health. They would act on their own. The only caveat with that is that it requires publication before it goes into effect, or it can go into effect upon publication. The joint order between the two boards would go into effect upon signature. So in my mind, those are your two best options. Those are the two most legally defensible options here. And my role for the rest of the meeting is to answer questions and do some wordsmithing. Thank you.
Great, thank you. I know do I ask comments from my members first, Chuck?
Yeah, absolutely.
Okay. Any questions or comments for Alex or anything from my board? Probably. Who wants to go first? Mike?
I just want information for our order, our process. There are some modifications to the original draft that Ms. Rubin prepared and had available for us. At what point in our process do we wish to get into that?
Alex, is that something that you can do while we're discussing? Or
yeah, I can share my screen and wordsmith as we go through the document and as folks have comments. So I can do that. I should be able to do that now. Let me
hold on one second.
Okay.
Maybe we'll have my board make comments, and then because they might be the same.
Okay.
Chuck, did you want to say something?
Yeah, just to kind of answer Mike's question, I think as far as process is concerned, Mike, I think what we're looking to do is have each of the board members, Board of Health, and then the Select Board, share their thoughts and whatnot, and then have Alex kind of bring us through if the kind of the pleasure of the boards jointly is to look at what a mandate would look like, bring up the draft, and maybe massage that and see if there's something that either or both of the boards would be interested in executing.
Okay. Let me have my board make their comments first. And so Kevin or Dan? Dan still here?
I'll go. The date we had listed, I feel like that might be a little bit far out, and somewhere a little bit closer to where we are now, maybe November 1st, something like that, to be revisited might be more appropriate than further out in 2022. My next comment is I think it was maybe Eileen who mentioned the potential ability to classify different businesses that might have the ability to open garage doors and almost potentially be an outdoor venue. or maybe have some attestation of their clientele. I don't know what the legality of that is. And yeah, what about repercussions or fines would we include in such mandate to actually have it have some substance?
Okay, and I think that when we reviewed it this weekend, where is Dan trying to get back in? I don't know what happened.
I'm not seeing him.
Did he quit?
Possibly. He's not in the audience.
Mr. Zeldin is looking to speak.
Okay, go ahead, Mike.
Yeah, I really don't want to. I was going to, on the issue of, we'll call it loosely compliance. I don't want to call it enforcement. It's compliance. I'm going to turn to Jim Gareffi, who's had many years' experience dealing with what do you do when, and he generally is one of the key folks who would be out and about as needed to quote enforce, and not that other agencies of safety in the town wouldn't be. So I'd like to have sort of a reflective, just briefly, Jim, if it's okay with the rest of us, to briefly describe the virtues, let's say 3 warnings or 3 notices, and then you get fined, or, you know, a rap on the knuckles. I mean, I'm not here to propose something. I'd like to get some idea about what works for our community and not simply looks good on paper.
That okay, Lisa? I'm all set.
Yes, please, Jim. Sorry.
So just, during all of the mandates and enforcement that we're doing prior to this, I mean, we approached it educationally. We would bring out the workplace, sector-specific workplace safety standards, because in addition to the governor's mandate, each one of those sector-specific workplace standards had a little bit of nuance about masks. Most of them were with masks. Some of them, again, with restaurants and things, they had some nuance to them. I think the overall statistics from the states indicates that there weren't a whole lot of fines being issued. I think most all of the state was doing the same thing. We were trying to go out there and educate and try to inform people what needs to be done. And in most cases, people were quite cooperative. A lot of times, the complaints that I would receive, I would follow up with them, and they were somebody didn't have a mask on at the time when the person made the complaint, but when I would walk through the store or walk through the business, really didn't see any compliance issues. So it's a little bit hard to kind of always catch that one or so. I mean, it's, I guess if there was somebody who was just kind of thumbing the nose at it, that's probably a little easier to give you a sense of how that might, whether you had I think in the case of the regulation, there are fines that are in place as part of that regulatory ability. So I think that the regulations may have that built into it. But again, I don't know that it's necessarily the best way to approach trying to fine people for not having their mask on. I think, again, it has been my experience through all of this doing the enforcement that 95, 98% of the people that I saw in businesses had masks on. So I don't know if that answers the question or provides the reflection that you're looking for, Mike, but.
As usual, Jim, it does for me.
Thank you.
I have a question, Mike. Did you mean 3 strikes per an individual that's not complying, or a business?
I don't like fines, so I'm probably the last one to go for this. But in general, I would think it would apply to both. Mm-hmm. I mean, if we get to the point where we need something, I'd like to, as it were, make sure that we're interested in people joining the community and being, as it were, willing to join in, and that the signaling and the effort to ask people more uniformly to wear masks has more to do with the reality and the situation on the ground. And just as maybe I'm giving you too much advance notice and no one cares, but there's now evidence that the effect of the vaccine wanes within about 6 months. And there's already evidence in the field that this is already starting. And if you're looking for a place where this has already occurred, although it's several thousand miles away, and a little bit extreme, nonetheless, the phenomenon has been confirmed and it's happening in Israel. They've had to go to boosters almost immediately because they're seeing a lot of waning because they started vaccinations earlier. So we are seeing the beginnings of that, along with everything else, along with the variant, along with it. So I'm reluctant to go further than 3 warnings, and by the 3rd warning, you get a fine, whether you're a business or an individual. And I'll put my neck out on that, and that's in reflection of the fact that I'm very concerned about the waning of the vaccine. I'm sorry to interrupt our proceedings. Thank you.
Okay. Dan, glad you're back. Did you have a
Sorry
comment?
about that. I unfortunately lost my internet connection right as Alexander was going into the Board of Health scope of responsibility and authority under a regulation as opposed to a joint order. I'm pretty familiar with that piece. I think I'm okay. I apologize for missing the comments after that. I will do my best to catch up, but thanks for checking.
Did you have a comment? No. All right, Chuck, I guess.
Okay, Lisa, do you want to take an opportunity for yourself or just go to the select board?
Yep, go ahead.
All right, so members of the select board, just raise your hand if you'd like to be heard and I'll call on you. Or I can just pick on you. Matthew, go ahead.
Thank you. Where do I begin? I think that the first thing I want to say is that it's pretty clear to me that mask mandates do work. There's been some debate about that, both amongst these board members and and some of the public comments that we've heard. But the science seems very clear that masking works to reduce transmission and that the mask mandates do increase compliance. So I want to start with that. As far as local businesses, Mr. Keene's comments hit me really hard. I went to his business for many years. I respect him and I understand his concern. What I think the counterpoint to that is that right now, according to the last numbers, we are on exactly the same curve that we were last year. And you've all heard the comments that those who don't learn from history are doomed to repeat it. Now that we don't have social distancing and we don't have a mask mandate, if the curve continues on the track that it's on, even with vaccines, we're going to be back where we were at the middle of last year with essentially a lockdown. And if the businesses think that a mask mandate is going to hurt, I think a lockdown is going to hurt much more. Mm-hmm. Furthermore, I guess the argument that people are going to go to adjoining towns, well, I don't think that the adjoining towns are going to be immune from this any more than we are. And I think that this problem is going to happen for everybody. If the COVID spreads badly and the businesses have to shut down because they don't have employees who can come to work, I think that's going to be much harder on them than the hardship that they suffer from having to have employees or customers wear a mask. The final thing is I think that someone asked, like, what are the criteria for lifting this mandate? Well, I mean, it seems pretty clear to me. We have criteria for debating whether we should put a mandate in place based on infection numbers. When those infection numbers go back down, we can lift the mandate. So I do think we need to have the mandate in place. I think that the unvaccinated children, although they may not be at risk for infection or death, are absolutely carriers and can transmit the disease. And the mask mandate is not about me, it's not about you personally choosing to protect yourself. It's about you choosing to protect those around you. And it's very selfish if you choose to not protect the others in your community. Thank you.
Thanks, Matthew. Paul or Cindy? Paul, go ahead. I was going to call you Cat.
Yep, that's fine. I have questions primarily, first of all, was a lot of talk of, penalties and not wanting to do this, that, or the other thing. But we have a specific draft regulation and order in front of us, and there's nothing in there about that. So what's the point of having something adopted when you don't, the subject's so uncomfortable that nobody even addresses what is the penalty? There is none addressed here. Unless I'm missing something, and I guess that goes up to Attorney Rubin. I believe she drafted it at somebody's request. I guess there's a first question. Am I missing something in the regulation, or is there nothing in there about penalties or process for enforcement, other than it says the normal agents of the board, which there's really only, all we have is in the Neshoba Allied Board of Health. Our police have made it clear that they are not the mask police. Our regulatory boards, similarly, the building department, etc., that's not their job. And so the only real enforcement, it's not in the job description for board members to go out and enforce. So if Jim Gareffi's still on the call too, I would ask him whether, how under this proposed regulation he would choose to enforce and what exactly he would be enforcing. And then if he's actually still on the call, I would be curious too to know of the numerous towns that Neshoba Allied Board of Health represents, how many others have a face mask mandate in place, and how is it working in those towns?
I guess maybe we can ask, I just think this is a draft, so maybe the enforcement part is something that we can work with Alexandra about.
Well, I guess those other questions.
Looking to do anything tonight, if we don't have, you can't adopt it and say, well, we'll get around to that part later. Well, no, that's an integral part of this. So is she on the call, Alexandra?
Yes.
I can speak now about it, or we can wait until all board members have commented, and then I can do more of a global response to all the comments.
Well, I would appreciate if you, because it might spur I have other questions too, but I can wrap this up pretty quickly if I can address that part.
I think Attorney Rubin, if you want to go ahead and,
So
framed with that there's going to be additional conversation around it, but if you've got something to speak to, then great.
Sure. So I specifically left that part blank on the draft. I did have a comment about it in terms of an option being that you can choose to put a fine structure in place. The town has a enforcement section within its code that mirrors the language of section 21D. I can pull it up actually. Let's see how well this screen share works. Bear with me 1 second. Essentially, it allows for the fining of businesses and residents. I specifically left that out, however, because my understanding in a number of towns that had done this previously, now they've left the fine structures out because they want this to be more educational than punitive. And my other understanding too is when the statewide mask mandate went into effect last year that expired, I believe, towards the end of May, it gave municipalities the ability to enforce it, but anecdotally, like somebody had mentioned, the police were not looking to be the mask police. They weren't looking to issue citations. Nobody was looking to fine people. I know that a number of police officers in various communities would stop people on the street and say, there's a mask order in effect. Here's a mask. I see you don't have one. But they really weren't looking to do a monetary fine. And it just my view, my quick scan of other communities that are passing these things right now, it seems like they're also kind of leaving that out because it just wasn't something that was enforced the last time around. But Sorry, let me see if I can share my screen and just pull up the section of the code that I was referring to.
Well,
Can you all see that?
kind of a breezy way of saying, yeah, we're calling it a a mask order mandate, and we have enforcement. Yeah, but we really don't, because we don't really want to do that. I mean, I'm not a big fan of that approach to things. If that's here with the intent, and I guess this question really is to the proponents, not to the attorney who drafted, but the proponents is this intending to be educational or punitive? And that was a question to take the language that was just used a moment ago. That's not what's presented to folks. I can't ever recall a place where we're being asked to vote on something where it has real consequences, and then that part's left blank. That's shocking to me.
Mr. DeCoste? Sorry.
Zeldin.
I'm sorry. I believe Paul must have been not aware of the earlier discussion, but it was decided, or at least as far as I was concerned, it was decided that the method of compliance, I'm going to use the word to encourage compliance. I definitely believe, my impression is that our board, that is the Board of Health, is indeed interested in making provision for fines, and thus seek compliance through the recognition that of individuals, the fact that we're seeking compliance by the fact that they don't comply after, let's say, 3 tries, and educational efforts, that they opened up themselves to fines. And the other thing, just for information, I don't want to confuse the issue. It is my understanding that Littleton's Board of Chief of Police is in fact an agent of the Board of Health for enforcement of its rules. And if that needs to be corrected or updated, please make that clear.
That's educational purposes, Mike.
Okay, fantastic. So I believe we have enough here so that we could take some of the provisions that have been posted by town council and have them inserted into the current draft.
And then that can be part of that further discussion when we do actually put the regulation up on the screen and kind of.
Fantastic. Thanks a lot. Thank you.
Paul, you also had a question for Mr. Gareffi relative to other communities that may or may not have a mandate in place, and whether or not there's enough data available at this point.
Well, my question is, if Jim is there, is really to twofold. One is if there were to be enforcement on his end, how would he do it? But I guess that's been addressed somewhat by Board of Health comments that that's not really what's intended, or at least Mike's comments. But I would be interested in knowing what's going on in the rest of and it's a question raised by one of the citizens who spoke earlier too, is what's the experience out there in towns? And we have the benefit that our health agent, the Neshoba Board of Health at this time anyway, represents, I think, about a dozen or so towns. I'm wondering what the practice is in those towns in terms of both how many have adopted health mask mandates and how are they implemented.
Jim, you comfortable with that question? You understand?
Sure. I mean, to my knowledge, at this point, I don't know if any of other communities have done. I know the town of Groton was looking at a school mandate at the time, but they didn't pass it. But I don't know if any other communities have passed a mask mandate at this point.
Okay, thank you.
There are a few, but they're probably not under Neshoba's jurisdiction, for lack of a better word.
Yeah, we did have, I mean, I saw data, in some of the information that was floating around the past week, that there were 7 communities in Massachusetts. I don't know if that list is exhaustive or not, but there were 5 that were already in place and 2 that were voted on and due to go into effect within the next few days. But if I hate to be getting all this information anecdotally with the expectation that we're going to take a vote that has serious ramifications for folks, no matter what your position is on it. This is kind of an awfully, and this isn't a particular criticism of anybody in particular, although if folks are serious about promoting this, I would think that the facts and the process would be a lot more thought out. That's an editorial comment.
There's usually some pretty good teeth in your editorials. I think, Paul, it is somewhat anecdotal, but I think Belmont was probably the first one to put something in place, and that was done on August 9th. So whether or not there's any data to support them doing it or not support them doing it, I don't know that there's any supporting or non-supporting information available.
I don't know if Katrina is, that's something, I have a list.
Let me, if I could just ask Ms. Napoli.
Oh, yeah, sorry.
Yeah.
Sorry.
Thank you, Mr. Chair. Thank you. Thank you, everyone. Thank you for the joint meeting, having the select board involved in this very important discussion for our community. We certainly appreciate you respecting us enough to have us involved in this conversation. I did do some research just on mass.gov about other communities that have implemented mask mandates closer to the city, Belmont, Arlington. I can't remember the other two communities off the top of my head, but it was kind of too soon between the dates that they had imposed their mask mandate and the most recent information that had been posted on the mass.gov website. In my opinion, to see if there was really, those mask mandates were really being effective. I did look at surrounding communities. I looked at Westford, Air, and Acton to see how their numbers are looking in comparison to the town of Littleton. Littleton has definitely been on a consistent increase over the past 3 cycles, whereas Acton, Air, and Westford have seemed to be fluctuating between lower numbers and higher numbers. And that is information I did share with the select board and the Board of Health. And that's just me doing some research on mass.gov as I like to do, just to try to inform myself and make an informed decision about this situation. One of the things I wanted to ask maybe of Jim Gareffi is, are we tracing breakthrough cases of the number of positive cases that have been reported in the town of Littleton? How many of those are, I guess, what are called breakthrough cases, are people that have been vaccinated but now are contracting the virus? Do we have that data?
I'll check that.
Yeah, please, Jim. Yes, thank you.
So the last 2-week cycle that the state reports, I always like to try to stay with the state report because those numbers are, everyone can see them. Mm-hmm. So Lisa had asked me to take a look at those numbers, see if there was anything, surprising, off, just to see what might be happening in those. And so there were 17 cases reported for the town on the last 2-week period of time. 7 of the cases weren't vaccinated, and 4 were, the vaccine status was unknown.
So out of 17, 7 were vaccinated and 4 were unknown?
Right.
Okay. Okay. And so I guess just trying to look at this overall, what's going on here in the world as we now know it. If people who are vaccinated are contracting COVID, it's really going to become the norm, just like with the flu, correct? COVID's never going to go away from the way I see it. So if people are getting vaccinated, and there's a high percentage of people in Littleton who have been vaccinated, according to mass.gov, which is great. But so, what's our objective here? If we're going to impose a mask mandate to protect people who have already been vaccinated, I know we have the younger population, the under 12 population, that is more susceptible to this virus. How many Littleton residents under the age of 12 have contracted COVID? Do we have those numbers?
In that 2-week cycle, I guess there's been 3.
Okay.
It's in the same family, Jim?
That I don't know. I didn't take down addresses, but 3 that are under 12.
Okay, thank you.
And overall, is that number higher since COVID's come about? Do we have that number of how many children under 12 have been?
I don't have that at my fingertips. From time to time, Mike or Lisa asked me to kind of take a deeper dive into the records, and so it's not done regularly.
Okay. I mean, to Paul's point, I think if having information like that, especially for a discussion like this, is really helpful, not only for the boards who are here on this call, but also for the public in general, just to see what we're really talking about. I get a little bit frustrated, to be honest, when people throw out statistics and data and information, from whatever sources they pull it from, because it's really a big decision, and it's really important that we have the right information before us. And certainly the Board of Health is the entity to provide us with those specific statistics. It would just help me have a better understanding of what we're facing and what's going on in our community. As was said before, we're in this as a community, certainly. With respect to the businesses, I certainly feel for them, especially to the gym members, the fitness facilities, and facilities like Salute, establishments like Salute that don't cater to children. People aren't bringing their kids to Salute. People aren't bringing their kids to Title Boxing or to Woodshed Fitness. And it bothers me to see us come up with some sort of mandate that's going to have an impact on those facilities. And I look at it this way. So I look at it as, a lot of people live in Littleton, but they don't work in Littleton. So they go to other communities and they work in a business that doesn't have a mask mandate. And then they come back to Littleton. So what is the difference between someone going to work out at Title Boxing that doesn't have a mask mandate, coming home to their family, as opposed to somebody who works, say, in Westford, and they work in an office all day that doesn't have a mask mandate, and then coming home to their family? Having a mask mandate at a facility like that that's going to definitely impact that business, I think, is something that we need to take into consideration. To the point taken, we are a community, and we need to look at this as a community as a whole, not in silos. And so I think it's really important as we go through this process and look at the document that Alexandra crafted for our consideration, that we look at mandates surrounding businesses like fitness businesses and establishments like Salute. I do have some recommended language with respect to the criteria for rescinding the order. I definitely think extending this through January is much too long. Preferably, me personally, I'd like to see this reviewed within 30 days by October 1st. I also wanted to talk to the board about their consideration of the language regarding performers at indoor venues. There's a lot of venues that have scheduled live entertainment, and other communities have adopted provisions that do not require those entertainers to wear a mask if they can socially distance 6 feet away from others. And I think that's something important that
Cindy,
we consider.
I don't want to cut you off. I know you put a lot of effort into reviewing the order and making some red line changes. We're going to get into that kind of as a full body.
Yeah, I'm throwing it out there now, Chuck, just to say that I totally get that.
Right.
I have 4 things. So when we bring up that document, just to give me a
Okay, let me put
placeholder.
4 tick marks next to you. I'll check
Yeah,
them off as you
exactly.
go through
Thank
them.
you. No, I appreciate that. But that being said, I'm on the fence about this. I have to be honest with you. And I know I got criticized for that before when I said it out loud, but I'm going to say it again. I really, really am torn by this whole process and this whole decision for our community as a whole. So I'll leave it at that for now, and we'll let the discussion continue. Thank you.
Thanks, Cindy. Thanks. And I will just add.
Can I respond to Mr. Glavy?
Sure.
I just want to respond to the anecdotal comment. There are a huge number of large scale studies that prove that mask mandates reduce transmission. It's not anecdotal. It can be anecdotal around Littleton and the surrounding towns, but that's not the important data that we need to look at. We need to look at what the science says, which is that mask mandates reduce transmission. And excuse me. And even if we look at, the numbers that Miss Napoli sent around to us, those towns.
Matthew, I appreciate that. And I think Paul, I don't think Paul was referencing, I think he was referencing the fact that each of us are speaking anecdotally about other towns around us and that kind of thing.
So I guess my point is,
I could just say my piece.
Why are we arguing that point? Yeah, go ahead.
All right, thanks. And I didn't really want to get into a point counterpoint. I think we've all been respectful of one another. I appreciate all the residents who have spoken.
Well, Matthew's called me out personally, and I know he'd love to make somebody a straw man, and I guess I suppose that'd be me. But I've supported unpopular restrictions in the past. Looked at a crowd of folks and told them no Halloween last year. Looked at the gleeful advocates from the Park and Rec who wanted to do the Oktoberfest again and said no. I would support and may support in this instance mask mandate. The case, the burden is on the folks prove it, and that isn't on national or international data. That's complete agreement stipulated. It's what is at the local level meaningful and effective, and the data, and people are willing to pull it out and throw it around when it appears to be supportive one way or the other. I'm asking the simple question: within Massachusetts, how many other towns have done what we're considering here? And then within our own proposal, what is the supporting data and documentation? Because what I did see, and I have no idea whether it's complete or not, is that there were 7 towns that adopted it within Massachusetts to date. 5 are currently in implementation. 2 are due to go into effect this week. The rate of positivity rate over the past 14 days for those, they seem to have a pattern there of about 8 to 10% positivity rate as a trigger mechanism, whether that was something they chose or that's just a statistic that comes out. But it was pretty clear in looking at that data. You compare that to Littleton just as how do we stand in comparison to that? And we're at about 2.3%. If I'm incorrect on any of that, please, fine. But I'm not being presented with, please, fine, show me that. But I'm grasping here. I guess I assume that if we're coming forward to entertain a proposal to implement a mandate on all of our citizens with impact on people, that it would be as a result of a lot more thought out proposal, fully considered proposal, supported by data that has meat to it locally. And I don't think that's too much to ask for. I don't need any convincing on the variance rate of infection and all the rest of it. Get it, support it fully, but we're not going to. Nobody's made the case to my satisfaction yet that local data suggests that we need to do this because local activity has done X, Y, and Z, and for comparative purposes, so many towns in Massachusetts looking at similar data did the following, and here's what their data was before they acted on it. Okay, so if it's too much to ask for at that, then I think we're, at least I'll know what the terms of engagement are here. I think that's pretty standard operating procedure to get that level of detail if you're being asked to impose a regulation of people. Again, I'm not unopposed to regulating people. I'm not going to stand on anybody's soapbox about civil liberties and all the rest of it. I am fully supportive of government acting to support public health measures. And I think the burden is on the folks proposing that to show the where and the why and the how.
Thanks, Paul. I did see Dan and Mike raising their hands. Not that I really wanted to get into a point counterpoint and that kind of thing, but if you guys have some points of clarification, I think Dan had raised his hand first, if that's okay, Madam Chair. Okay. Dan, if you...
You're both okay? Cool. One, again, I'm sorry I lost my internet connection. I did not realize when I came back in that we were doing member comments. So I would, one, ask, is it possible for me to make a member comment at this point? If not, then I can just address some other issues.
Madam Chair, I'm good with it. You good, Dan?
Thank you, sir. I think I proposed this in our last one. Kevin and I both made motions, so I'm happy to throw myself out there. I think we're looking at this a couple different ways, and I think we need to. I think Paul's points and questions are completely valid. In general, this is none of us want this. I'll be honest. This summer, no masks, not getting out of my car and not having my mask and going, oh, I don't need to turn around and go get it. We are all on board that we don't want to have to wear masks, me included. It was wonderful having a regular, normal-ish summer. It was great. Being out with my scouts and my family and traveling was wonderful. But unfortunately, we're not in July anymore. That we're seeing, Delta has changed from we did vaccines, we did masks, we did distancing, we did all the standard public health measures to break the cycle of an infectious or communicable disease. And it worked. It was awesome. We are now dealing with Delta, which is a different variant, and it is behaving differently. CDC has said we are dealing with a different virus, and we really are. And how can we get back to where we were in July of normal? And I think that's kind of where we need to think. None of us want this, but as professionals, as elected members, that we need to look at how can we get back to where we were? How can we break this cycle again? I'm hearing vaccines, I'm hearing masks, I'm hearing distancing. Again, we're back to where we were in April and May, that this is not a either or, this is not a this or that. It really is how can we look at this as a group? How can we look at this as a set of tools in our toolbox to address this challenge? And I definitely agree. Vaccines are awesome. I would say that in the last, I believe, since the last week of June, our eligible rate has gone up about 3% here in town. As anybody in public health knows, the first 50 or 60% is easy. That next 20% is hard, and that last 20% is nearly impossible sometimes. I think we're hitting that vaccination threshold of those who will be vaccinated have been vaccinated in the eligible population. So we're not going to vaccine our way out of this at this point, as much as I wish we could. For all of our vaccinated folks, we're seeing multiple studies. J&J is actually doing great. Pfizer is not as effective, particularly those folks who got in, their immunizations early back in December, like me, that at this point, most of the studies are saying my immunity based on my vaccination is somewhere down in the 30, 40, 50% range, depending on the studies. So we need to figure out what that next step is from the vaccine side. That is beyond our scope as Littleton. That is CDC, that is state. But that's where we need to be looking, going, vaccine, 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 everything else can go away. That's not necessarily the best way at this point with the information we have. I'd love to be able to say it's all gone, but it's not. Looking at masks, again, as a clinician, we wear masks to protect others from ourselves most of the time. Our standard surgical mask is not to protect me from you, it's to protect you from me. If I need to protect me from you, I'm wearing a respirator. I'm wearing an N95, I'm wearing a PAPR, I'm wearing something that is truly filtering out what I get. Source control is critical for the mask piece. So folks saying I'm vaccinated, I don't need to worry about it, isn't necessarily accurate. We know that Delta is, while not, even though the viral load in the nasopharynx is similar to unvaccinated folks, it is not quite as infective as if I was unvaccinated, but I do still have a significant viral load. I can still shed that virus, even if I'm asymptomatic or minimally symptomatic. I can still be spreading that virus to others, vaccinated or unvaccinated. That mask really breaks that, is the most effective piece of breaking that chain, that root cause analysis piece. Where are the places I can break that chain? That's one of those places I can. Masks on myself do provide some protection, but they're much better at source control rather than infection prevention. So again, we're trying to look at lots of different pieces. How can we get there? I don't want masks either, but I want to make sure that we can be effective. Our vaccination rate here in town is awesome. We're about 84% for our eligible population. That's great. But we're still only 73% for our total population. And from a public health perspective, I don't want to look at just a certain population. I need to look at the whole, because that means I have more than 25% of my community are potential vectors for infection, either to become infected or to share it with others. And I have a potential vaccinated pool who aren't fully protected at this point. That's concerning from a public health piece. So, I think it's probably pretty clear that despite not wanting masks, I see it as a minimally invasive response to a trend. I hope I'm wrong. I hope that, we flatten this curve, it goes away, all is well. People get mad at us for putting out the idea of a mask mandate. I'm perfectly happy if people are mad at me, but our town is safe. I would have a concern, and again, this is personal, not out of the stats, but if we say, well, let's see how it goes, and we now have gone from an asterisk report in July, less than 5 reportable cases, to 17 in our last DPH reported time window. If we're at 27 next week, we're 35 or 40 in the next 3 weeks. And we had a bothersome but relatively minor action to try to break that. Again, public health, when it works, is invisible. Everybody gets mad at you because nothing happened. That's, it's how do you find that line? Just to clarify for Paul, since he asked, I've just double checked. We are now at 50 communities in Massachusetts who have implemented or placed the order if it has not already gone into place in Massachusetts, 15 in Middlesex. So I do not believe we have any in the Neshoba, but we have 50 in the state and 15 in Middlesex County out of 52 or 3 communities in Middlesex. So we're certainly not pushing the envelope of being the cutting edge of the sphere here. We're in the middle of the pack in many ways, and for a community that is very proactive about so many things, this isn't something necessarily cutting edge. As far as local data, we haven't mask mandated since last year, so we need to look at that bigger global data of do masks work in general, and it does. The mask mandates here in Massachusetts so far are too new to identify a causal relationship. The data simply hasn't caught up with the mandates yet. I know Cindy shared some information looking at a couple of communities and what their rates are. The data hasn't caught up for infection rates with those mandates yet to really be able to say it's effective. And we're looking at relatively small ends that, the ANOVA analysis does not get there yet. We're just in populations that are too small. We need to look at bigger data going, masks work, enforcing or encouraging whatever tool we use to say masks need to be worn. That's how we start breaking the chain, along with VaxBus and the rest. Increasing our vax rates and boosters and following the CDC guidance. Sorry. Thank you, Chuck. Thank you, Lisa. Appreciate it.
Thank you. Appreciate it, Dan. Cindy, I just wanted, Mike's been raising his hand since Paul spoke. So if I could jump back over to Mr. Zeldin and then pull you in. Lisa, you still okay with me kind of driving the bus right now? I can't see her, so I'm going to go with yes. Well, there you are. Mr. Zeldin.
Thank you very much, Mr. Chairman. I'd just like to address a point raised because it's fairly important. First of all, as Dan was trying to indicate and maybe succeeded, our purpose here in the Board of Health and should be for the select board is to prevent, not necessarily to cure. The vaccine is, along with masking, is preventive. Let me suggest that our criteria cannot be restricted because of our past experience to merely looking at the Littleton data as justification. We are part of a much larger community called the Middlesex County. And the only reason I'm picking on Middlesex is because the numbers exist for that. That's the way the state collects the data most reliably. And more importantly, we now understand from past experience all over the world in many major cities, including of all places, London, that the disease flows somewhat chaotically, but we won't go in the mechanics of this, but it flows from places where it's hot to places where it's cooler. So Middlesex County, of which we are a part, really should be what we're looking at. And as far as I'm concerned, it's what I look at in my work with the Board of Health and in conversations with other professionals dealing with other matters. So I would like to suggest that the criteria that we're using here should be the community that we're really a part of, and that's Middlesex, not the bubble that doesn't exist over this town or any other town in Middlesex. That's the best we can do to track something in a way that can be understood. So the proposal is very simple. In order to, whether or not we decide to do it 30 days from now or whenever, the criteria should be what is the rate in Middlesex County and what are its trend lines. Collecting data about Littleton is great fun when we are really hot. Then you can really see things. But this is not, we should use the history, what we've learned, and then that is, let's prevent getting there. I don't want to be a hot town. And already the community of which we're part of, you can think of other towns in Middlesex that have issues. You can think of them as our suburbs. our next door neighbors. There are no barriers to this virus. And the counting area should be Middlesex. And it's always been my, shall we say, assumption that that's the criteria on which we would base the decision to basically cut back or end the mask mandate. So to answer your question, Paul, it's the measurement of Middlesex County.
Okay, even though this won't apply to Middlesex County, it'll only apply to us.
That's correct. And the reason for that is because the nature of the disease.
I used to work at Middlesex County. I'm familiar with the 56 cities and towns. It extends from Everett to Ashby. I get it. I get all the above, but none of that is really spelled out how this is really going to fit in with all the various towns in Massachusetts who have made decisions one way or the other. I've just heard 50 towns. That's great. We just got during this conversation, an email sent out or a text sent out that had data, looked like it was fairly recently updated, had 27 towns in Massachusetts. It's all over the map, but I think it bears looking into if we're going to act locally to address something that's at least countywide in its nature, then I think it behooves us to get as much information from what drove those decisions, pro and con, in other towns as well. So I support you as far as taking a global look at things, at least within the context of Middlesex County. I'd go one step further than you, Mike, and say we should be looking at it statewide.
All right, Ms. Napoli, you had something to say, and then if I can comment as well.
Thank you, Mr. Chair. Just quickly. So as far as the data that was recently circulated about what's going on in other municipalities, a lot of those restrictions are not to the degree that's being presented tonight by the Board of Health in Littleton. A lot of those restrictions are basically geared just towards municipal buildings and not the community as a whole. So there's a very varying degree of what those restrictions actually entail. And I just want to make sure the public's aware of that. There's not a multitude of communities in the Middlesex County or surrounding areas right now that are choosing to adopt a restriction, like a mandate that we're looking at right now. So I just wanted to make that point. And the other thing I just wanted to ask is, where's the governor in all of this? Where is our leadership at the state level? I mean, honestly, from the comments made by Mr. Zeldin and other members here tonight, you know, basically what we're facing, what we're seeing in other countries, the Delta variant and the, you know, how it's acting and behaving and whatnot. How come the governor hasn't issued a statewide mask mandate? If we're in such a dire situation as a community and as a in the Commonwealth, why are we hearing from our Department of Public Health? Like, I would just like to know where they stand on this issue and the mask mandate. I'm just really surprised from the information I'm shared that we're not hearing more from the governor about this, if this is such a extreme situation that we're facing.
Mr. Chairman, I object to the characterization.
Michael, if I could just go ahead, Mike. What do you, I mean, sit there and shake your head like
no. I just found it astounding. No, I found it astounding that no one has used the word dire. We're in the business of preventing dire.
All right, so I'm just going to say my comments then. Thank you. So Cindy, you kind of stole my thunder a little bit, and that was one of the points I wanted to make, was that that the governor actually had a press conference today at noontime. He had a lunchtime press conference, and I somewhat anticipated that there was going to be something on a statewide level, which, as happened last week with the schools, DESE said that there was going to be a mask up in the schools until October 1st. So I sort of anticipated with today's press conference from the governor that was going to take some of the wind out of the sails of folks that wanted to make sure that there was a mask mandate in Littleton. So, and I appreciate all the time, effort, research that there's every single person that's on this call, whether you're on one of the panelists or you're someone that dialed in, everybody here is passionate about what they believe, regardless of what side of the issue you're on. And that's very much appreciated. But the state and CDC have resources available to them. No disrespect meant to any members of our select board or our Board of Health or Mr. Gareffi or anyone that's advising us. Katrina's been an amazing resource for us and others as well. But the fact of the matter remains, Cindy, to your point, that the governor has not issued a mask mandate statewide. He's recommended that we follow the CDC guidelines. There's not been something, Mike, to your point, that nobody's said that it's a dire situation. But some will have you believe, in order to make their point, that it's scarier maybe than it is. So I did want to make that point, at least, that the state has a lot of resources, a lot of people that are 100% focusing their efforts and their time and their energy, and it is their profession to do this. I realize we've got resources right here on this panel that are professionals and epidemiologists and have education to be able to opine. But the folks that work for the state, or the folks that work for the federal government to make these decisions to try to protect us and in public health, have not advised us to put a mask mandate in place. So that's, Cindy, you mentioned being on the fence. That's where I'm struggling with this. Is there's a lot of people that have a lot invested in it that have not put a mandate in place. So that's I'm open to listening and continuing the conversation and taking a look at what the draft order looks like, and see if we are able to come to some sort of a compromise and put something in place. And again, Cindy, to your point, maybe it is something that is a creep, crawl, walk, run, where we take a look at those buildings which are in our control, the municipal buildings that we have, the schools we know are already in place. So maybe those are the other buildings that are in our control, under the care, custody, and control of the municipality. We could put something in place. And that's what many other communities have done, where they've had the town employees or anybody that goes into any of the town buildings or offices has to make sure that they're masked up. So looking around, I don't see anybody waving their hands or giving me one finger wave. Gino is on the call. At least I don't know if you wanted to allow him an opportunity to speak, or.
Sure, Gino, did you have any comments that you wanted to make? You need to unmute yourself. Gino, you have to unmute.
No, leave him alone. I love this, Gino.
I'm mute. Okay. Can you hear me now?
Yes.
All right. Only thing we have to do is almost 80% of the population in Littleton are being vaccinated. And also, I noticed Thursday, the our administrator, Anthony, I have to say thank you to Anthony. He had a big bus, and he has 34, close to 40 people going to the point, and they had a vaccination. They were vaccinated. The question that we have to you can't force anybody, but you can suggest trying to get vaccinated to protect yourself and others. And also about the mask. Just to give you an example, I went to Salem and I went into Market Basket, and they stopped me, and they say, why you stop me? I said, oh, by the way, we have it because that for that moment, until October, anybody that comes to the Market Basket has to have a mask. So they were kind enough not to throw me out. They gave me a mask and I put it on and I went in and did my business. I mean, you can't penalize. I know we have the power between the selectmen and the Board of Health to penalize somebody because doesn't have a mask. That is not right. We have enough trouble as it is. We have to try to suggest, and even the policemen, if they see somebody if it has to go someplace and they require a mask, you go to the hospital, you have a mask. You go to the bank, some of them ask you to put a mask on. Not every bank that you go to. The question has to follow the CDC, the governor, okay? When I spoke to him, he says, Gino, sooner or later, it's gonna go away. But it will stay with us for a long time. So it's just like have a flu shot. Every year we might have to have a flu shot, and we might have another shot. You never know. So let's not be dramatic. Oh, we got to penalize or $300 for the police to give them a ticket. Come on, give me a break for crying out loud. Give it to me, the $300 so I can give it to charity. Thank you.
Okay.
They shut me off, right?
No, we can still hear you, Gino.
Okay, I thought I was talking to myself. Thank you. Listen to the governor. He's trying to do as best as he can. Never trying to tell somebody how we supposed to. We can regulate it. We can suggest it. That's all we can do. We can't penalize anybody. That's voluntary. So far, we have no problem. Very small amount. Out of 10,000 people, what, 17? Give me a break. Some of these people are sick anyway. All right? And some they get sick. They have to wash their hand like I do 10,000 times. If the police says, give me your prints, I don't have no more prints in my fingers because I wash every time I go someplace. Okay? And I put a mask when I have to. If they ask me, I put it on. I mean, this is getting ridiculous. Everybody should write a book, for crying out loud. This is not right. We are in a small town. We should not prohibit individuals to judge their own action.
Thank you, Gino.
Oh, I'm getting a heart attack.
Put it on mute so you don't give us one.
I love you guys. You do the best you can. I appreciate what you guys doing. But I wanted to make sure that my board understand what I'm trying to say. We're supposed to work together. If something goes really bad, the governor will let us know, and then we'll react the best way we can. Thank you.
Madam Chair, I believe the floor is yours.
Thank you, Gino. Should we go to Alexandra and see what she?
I think that's a good path. I think that's a good path forward, is to kind of walk through the joint order, and she can talk through the different options for us.
All right, let me share my screen. Can you all see that? Can you all see the Word document?
Yes.
Okay. All right, so I'm just going to go through this document, and to the extent that I can answer some questions or concerns while I go through it, I'm going to do so, but feel free to shout out questions and comments. The basis of this order is based on the COVID-19 caseload and positivity rates in both the town of Littleton as well as Middlesex County, as well as guidance from the CDC. And in consideration of the transmissibility and contagious nature of this particular variant of COVID-19. So I think that captures the distinction between what was going on earlier in the year and what's going on now in terms of transmissibility. The Board of Health and Select Board have determined that there's a disease dangerous to the public, and therefore they're doing this order pursuant to this particular statute and all other statutes and regulations that could govern it. I said effective September 1st. You can decide whether that date's good or not. Face coverings that cover the nose and mouth are required for all persons, regardless of vaccination status, aged 2 years or older. And I took the 2 years or older directly from CDC guidance. I will tell you that I've seen other municipalities boost that to 5 years or older. So again, that could be a point for discussion. In all indoor public spaces, clubs, municipal buildings, houses of worship, or private spaces open to the public. Food service establishment customers can only remove their covering when seated and consuming food or beverages. So the idea behind that would be if you're at the table eating and drinking, then you can take your mask off. I've seen it done both ways. I've seen it just when you're eating and drinking. I've seen it when you're seated at the table. So that's another thing to consider. Same thing with indoor performance venues. Lodging guests are required to wear face coverings inside the hallways and other common areas of the establishment, as well as employees. Residents and employees in multifamily dwelling units are required to wear inside the hallways and other common areas. Notice needs to be posted. Fitness centers, health club employees, customers are required to wear face coverings during all fitness activities, including group exercise classes. Customers of personal service establishments such as barbershops, hair, nail salon, massage, esthetician services are required to wear the face covering during services, except to the extent that the service is on the face. So like beard care. And then they can take it off to have that service done. All business open to the public must conspicuously post notice at entry doors. Employees must supervise and enforce this requirement, meaning that if somebody walks in without a face covering, the employee should offer that whomever at the business should offer that person a face covering. I have nothing in this order shall affect the state and federal orders already in effect regarding essentially various industries and various transportation systems that are covered by specific state and federal orders. So I know ride shares, taxis, buses, healthcare facilities is covered by a state order. Congregate care facilities is covered by a state order. So like a nursing home or something to that effect, like a shelter. I did put nothing in this order shall affect the mandates established by the DESE commissioner. I do want to comment on that. I know that during the public comment, there was some conversation about the fact that come October 1st, it seems like the DESE order can be lifted. That's sort of the case. If you read the commissioner's order, what it actually says is that DESE and the commissioner will continue to look at the levels of transmission in the state. But come October 1st, a school can lift their mask mandate if 80% of the staff and students in the school are vaccinated. Then those who are vaccinated don't need to wear the mask. So it's not that come October 1st, poof, the masks go away. It's quite more restrictive than that. And DESE hasn't decided how they're going to calculate that 80%. I imagine at some point in September, they'll give the school departments notification as to how to get to that 80% calculation. So I just wanted to flag that in case you wanted to do something post October 1st, or if you just wanted to leave DESE as the arbiter and enforcer of the school mask issue. Notwithstanding anything in this order, employees that are alone or within their closed office spaces don't need to wear a face covering. So for example, if I'm working as an attorney in Littleton and I'm in my office and I have the door closed, just because I'm in technically a space that could be open to the public, I'm not going to wear the mask if I can close the door and kind of pull myself away. Notwithstanding any provision in this order, here are the exceptions. Face covering should not be placed on children under the age of 2 years old, anyone who has trouble breathing, unconscious, incapacitated, can't remove a mask without assistance, or anyone who due to disability is not able to wear a mask. To the extent order, so I modified this based on conversation. Obviously, this is just some wordsmithing on the fly, but it shall be enforced by agents of the Board of Health. I did add in language about a civil fine after verbal education and written warning of up to $300 pursuant to the various sections that allow for that. Again, I will say, I'm just putting it out there that enforcement could be an issue. You want to be consistent. I'm not clear on how the verbal warnings would be tracked, but I leave that up to you to decide. The order will be reviewed on or before I put in October 1st. Again, you can decide the date. There was conversation in the public comments about the select board, or excuse me, the Board of Health being the determiner of when to review and when to rescind and on what basis. You can choose to put in this order that the Board of Health will be the entity in charge of doing that. So essentially the select board at this point, they're signing on to the order, but they're giving it up to the Board of Health to decide when to review and when to lift and on what basis. So that way it negates the need to have another joint meeting every time you want to look at this order or decide to rescind it or modify it. So I will put that option in a comment. I said that it can be rescinded at any time by a joint vote of the Board of Health or Select Board. The optimal criteria would be based on community transmission levels as being low or moderate over a 4-week consecutive period, and that would be governed by the CDC data transmission rates. I believe they're updated weekly based on county. I will tell you that I've seen a lot of 2-week periods. I took the 4-week from the Board of Health draft from last week, but I have seen 2-week as being quite popular. And then I know the Board of Health had an and about the vaccination rate. My suggestion is an or, but I'm not, the substance of this is not up to me. It's just the way that I drafted the order. But I took the language from the Board of Health motion from their last meeting. Vaccination rate of town residents, and actually I modified this. I had said who received at least one dose of the vaccine. I believe the Board of Health motion was the residents who are vaccinated reaches 80% of the total population. I changed it to eligible population. Again, I'm a little wary of using children who are under the age of 12 within the rate of vaccination because they can't be vaccinated. And I wanted to flag that, but again, this is not my order. This is your order. But so it's a topic for discussion. There's a savings clause that if any provision is deemed illegal or unenforceable, the order stays in effect and the town administrator is authorized to take further action to carry this out. So that's the order as it's drafted, as it currently looks now based on some of the questions and comments. And I'm happy to edit it as the conversation continues tonight.
Thank you, Alex. I had a question. Can you scroll down to 13? That seems to be, I can't do it because it's on your screen. So 13A, level of community transmission data from the CDC control for Middlesex County. Is that CDC or is that DPH? Where we get that information from?
CDC.
Okay.
It might be posted, the DPH might post it on their website as well, but it's the link, the data and the maps and the color coding come from the CDC.
Okay.
And I will say almost all of the orders that I've seen recently that have been passed about these mask mandates use that as a level of measurement to determine whether or not to lift or rescind.
Mm-hmm. Mm-hmm.
Yeah, I know that Dan had commented on 15 Middlesex County cities and towns have enforced some sort of a mandate. I haven't been able to find that data, but one of the things that I sticks out to me is the city of Lowell is part of Middlesex County, and that those numbers can very much skew the data on the county level. So I'm not sure how comfortable I am with. I understand the whole community conversation in the world. We're all one big happy family, but if part of the population is less responsible and not doing as good a job as our residents are, I'd hate to punish our residents because another community has tanked the numbers. So I challenge that to some extent.
I will say that I included language that the optimal criteria for rescinding, so it's not whether it's shaded, I think maybe yellow or green. It's not based solely on the lower moderate designation, so that's why I added in the word optimal criteria. It just makes it more flexible. But again, that was just an edit that I made.
With Alexandra's screen shared, I can't see the whole group, so I don't know if anybody has hands raised.
Madam Chair, I know that Cindy had some comments as she started to bring them up during the earlier comments. Are you okay if I
Yeah, go ahead.
ask Ms.
Right.
Napoli?
Sure. Thank you, Mr. Chair. Alexander, can you restate what you just stated about optimal criteria? Can you explain that again, please?
Yep. So I've seen a number of orders that base the rescinding essentially solely on the CDC levels of transmission. What my proposed language in the draft is that the order will be reviewed by the Board of Health and Select Board. And again, we can change this and just have it be the Select Board, the Board of Health only. I've seen that done as well. But the order will be reviewed by the Board of Health and Select Board on or before. I changed it to October 1st. And may be rescinded at any time by a joint vote of the two boards, or if you choose to just let the Board of Health do it, then by a vote of the Board of Health. And then I added in the optimal criteria for rescinding this order will be based on data that indicates that essentially the level of transmission in Middlesex County for 2 weeks is low or moderate based on that CDC tracker. And then some various criteria about the vaccination rate for the town. I based the draft of this order on the motion that was discussed at the last Board of Health meeting. I believe that that was more stringent than this. So I wanted to draft it to give a little bit more flexibility just as a discussion point for the two boards. But I'm happy to make the edits that you all see fit.
What is the level of above moderate? It's 4, right?
Like,
Low?
yeah, there's 4. It's like, I don't actually know, to be honest with you.
It's substantial and high.
And substantial and high.
Okay.
Substantial and high.
Yeah. Substantial and high.
Does the Board of Health have any idea at what low would look like? What would those numbers look like for Middlesex County to have to be considered low in this category?
I'm not sure, but Katrina might be able to answer that.
I just, to Chuck's point, and if this isn't a state mandate, if we're just doing this as the town of Littleton within Middlesex County, and there's going to be other communities in Middlesex County that might not adopt this level of a mandate, I have a problem with being at the mercy of another community that might not be as diligent as we are being here in Littleton to achieve that threshold, thereby punishing or limiting residents in Littleton. If we're at Littleton's at the low, but Middlesex County is still at the higher.
Substantial.
Yeah, so it's out of our control. What other?
I'm sorry. There's some misinformation going here. The rate, the Littleton historically has basically tracked eventually the trend lines of Middlesex. The numbers, the magnitude of the numbers may be different, but the trending line is the same. That is, when any town in the towns in Middlesex, when they begin a process of spread, community spread, that's town spread, it happens to all of them, but at slightly different times, but they all eventually join in. And we saw this last time, even when just before the vaccine got, shall we say, put in, and the masking began having, shall we say, a dragging effect. But up until that time, you watched our numbers climb, maybe with a delay of a week or so after other towns in Middlesex began climbing. So I'd like to emphasize again the importance here of not looking at this as punishment or being punished by Lowell or any other town or any other circumstance. It's prevention of spread. Prevention. Health care is prevention. Public health is prevention. And we're not acting here in order to punish anyone or to basically have Littleton in an inferior position or have it looked at because Lowell's numbers happen to be running, shall we say, population-wise larger than ours. It's this tendency, we're trying to avoid the onset of spread. Prevent, prevent, prevent. That's why we're using Middlesex. And we do not have a bubble over us, and we don't have a moat surrounding our town.
Can I finish now, Mike? Thank you. I'm just trying to understand.
Please stay on the topic of prevent.
Mike, I'm just trying to ask a question and understand the language. I'm sorry if I didn't use the right verbiage. Please let me finish. So personally, I think low is too low without knowing what that number looks like. But to Mr. Zeldin's point, if we're on this curve and we're all riding this together, I guess it's not going to matter where Littleton's at because we're going to fall in sync with other communities. So we'll leave it the way it's written. I would prefer to have an and or in there as opposed to or. And at this point, I'd like to know what the current vaccination rate is for the town of Littleton, based on this language that's in subparagraph B. Where are we at now it says when we reach 80% of the eligible population? What's the what number are we currently at now?
We're right under 84% of eligible population.
Right under 84%?
I believe so. The Board of Health could confirm that.
Chuck, can let Katrina come on? She has the data.
Certainly. I don't have a problem with that.
Great.
Katrina?
Hi, okay, I'm on. Sorry about that. Is there a way I could share my screen?
I'll have
Just say your name
to,
and address. Katrina, name and address.
Oh, yep, sorry, Katrina Wilcox Hagberg, 156 Hartwell Ave.
Thank you.
right now you're only on for speaking, Katrina, so it would be
Well,
up
it was,
to the board
I was,
to let you
yeah, I
return.
totally understand that. I was just trying to show Cindy what the CDC's community transmission levels look like and how we look compared to Middlesex County and for the last 2 months. If that is of interest, if not, it was in the documents that I sent to the board last week.
I would
In the
just be
summary.
curious to know what it looks like at 20%. If there's an example of that, or
So when you're saying at 20%, like that's not 20%, that's 20 new cases per 100,000 people in the last 7 days. So it's a rate so that we can.
okay.
Oh, Katrina's been muted.
I'm back, sorry. So let me share my screen so I can show you what these CDC transmission levels look like. So you can see how we fall to the other, to Middlesex County. So I'm assuming you see my graph.
Yep.
Okay, so the CDC takes the total number of cases in a 7-day period, and then divides it by the population, and then multiplies it by 100,000. So you can compare different sized areas, so different numbers of population over the same period of time. It gives you a chance to compare areas of, Littleton can be compared to Lowell, can be compared to Boston, can be compared to Harvard, which is smaller than us, so over the same time period. So this is what the CDC community transmission indicators look like for Littleton, Middlesex County, and the state. And this is a very similar pattern that we had all last year, that Littleton may be a little bit lower. Like you can see in July, we were a little bit lower than Middlesex County and the state, but then when they were in yellow, we were just below them in the low, which is the blue. And then yellow, they didn't tip over into orange. Actually, all of us tipped over into orange at the same time on the end of July. And then you can see, because Littleton is so small, a few cases can really shift our rate estimates. So Littleton looks like this very jagged line. And at this point in time, we're actually higher than the state's community transmission level. So I personally, as an epidemiologist, think we need to look beyond our borders when we're considering what metrics to use as this kind of threshold decision-making limit. And Middlesex County is one that is recommended by CDC's people who, the DPH here in Massachusetts also gave us county level numbers all last year. So this is a common area gathering mechanism that has been used. And there were times last year that we were higher than the county, and then there were times we were lower than the county. But for the most part, having a broader population helps us smooth out those numbers a little bit and gives us a much more clear picture of which way the trajectories are going. And because Littleton isn't, we're not sitting here with tall walls around our borders and our people are just staying inside of it. We are working and playing in Middlesex County, in Worcester County, who is also in the red right now. So having that broader area capture is I think, important just because it reflects our socialization patterns right now. And then the other thing that I think is very valuable is that the CDC data is updated multiple times a week. And anyone can can get on their website and just click on their map and see where we are as a Middlesex County. So it's accessible for everyone at any point in time to help with their decision making, depending on how this gets implemented. So that is, that's how the rates work. Does that answer your question, Cindy?
It does. I appreciate the explanatory information. To support the language. Thank you.
So let me just jump in there. I'm sorry that you brought the chart off there. We saw that blue spike. That's current. That's right now. So that's with one family of 6 can
That's
skew
the
our numbers.
17 cases that occurred in the last 2 weeks. So that,
Right,
I know you said one family of 6. There were multiple families in there. Just one of them was large.
I understand, but with one family of 6 can skew the town's numbers a lot more than across Middlesex County.
Exactly. Yeah. And we ran into that last spring where everyone else was dipping down into the yellow and the green, specifically the green and the gray, a lot quicker than we did. And it turned out there were a couple large families who had household spread, and then we were stuck high and everyone was like, why are we different? Right. So, Littleton tends to come down a little slower than other towns, given our past history for whatever reason. So it's, this actually might be beneficial to us in some ways, to be honest.
Thanks, Katrina.
Right. And I do, so the at least one dose is, I believe we're over 80% with at least one dose of the, for eligible population. We're actually pretty close when we just take everyone as a whole. We're at, I think, 78%, 79%, at least one dose. So those are actually really great numbers to start. I personally, if we're using this as a way to try to encourage people to vaccinate, using that fully vaccinated status, I think is something to consider or debate, because we are seeing that fully vaccinated status is what's conferring protection against Delta, whereas one dose is not enough. Those mRNA vaccines are not enough with that first dose. So once you complete your second dose of the mRNA vaccines and you get full vaccination 2 weeks after that the only dose of J&J, then you kind of, we as a community will have more protection from spread just because they are more efficacious.
Thank you.
Great, thanks.
Cindy, you had more points? Or?
Yeah, can we bring the motion back or the?
I see you, Matthew.
I just want to talk about this specific 13A if we're going to move on.
Cindy, you okay with that?
Yeah, can we just bring it back up so I can just see it for a sec? Just based on what, so you put in the fully vaccinated, perfect, and we did and/or. Okay, great. I do have other comments, but Matthew, if you want to comment on this, go ahead.
I would just suggest removing and the select board. I think that the Board of Health is responsible for this. I appreciate the reasoning behind having both boards vote on the motion to begin with, but it would seem to be more bureaucratic to bring both boards in to have the vote, and I would defer to the Board of Health on this one. It's not just a suggestion.
Well, do you want to just put that note in the margin there, Alexandra, for a potential edit? Because any of this is going to be.
I have it kind of right here.
Okay, I'm sorry. I'm looking at my screen and thinking it's not changing. So.
Can you see my notes? I can't see. What
Yes, we can.
Sorry.
I also just want to say that based on the previous conversation by Katrina, I highlighted eligible. I can get rid of eligible. It's up to you. I just made that as a highlight to myself to either delete it or not.
I don't think so. I think it's appropriate.
Eligible looks fine.
That makes sense.
I would say from a public health perspective, total population it's vector control. Total population is more meaningful than eligible.
I would agree.
I don't agree.
I would agree with that too.
What if people who aren't eligible bring us below that percentage number, but they can't get the vaccination?
Then our population is not adequately vaccinated to provide protection. That's kind of why we pick those numbers, is that again, herd immunity is never used correctly in public discussion, but the idea that there are always going to be those people who either are not able to get vaccinated, even in universal vaccinations, or do not provide or do not produce an adequate antibody response to be able to protect themselves. So that if we have 25% of our population unvaccinated, either by choice or because they're unable, either due to medical condition or by age, then we still have a significant potential infectious or communicable disease pool out there, so that we are not we're not closing that link in our chain. We've got masks, we've got vaccines. We have not closed that link in our chain.
So how will we close the link?
We'll never be
then?
able to close the link.
We'll never be able to close the link.
Why?
Just based on what you just said, we'd never be able to close it if that's the situation.
If there's a population that can't be vaccinated.
So we have 13% of our population who is under 12. That means we have 87% of our population who is eligible. Now you figure 5% of those because of medical conditions might not be. If we get a high percentage, then we're there. Now this does not mean, again, this is optimum criteria. If you read the note, this is our optimum. It's not necessarily a minimum. And again, this is reviewable. If we're at 79% of the total population and our rates are 1 case per 100,000, we can, under the authority here, this is not saying we must, or that we cannot rescind this order until we reach this. This is simply some endpoint criteria that we can choose to use or not use based on clinical discussion. If we're at 79% and our numbers are great for 4 weeks in a row, there's nothing here that says we can't go, you know what, masks can go away. But if we want to treat this as optimum criteria, then we should treat it as optimum criteria. And that's looking at it from a public health perspective, not a easy to count or who can or who can't. It really should be from a public health perspective. And that is looking at total population as a protected pool, a protected body.
You haven't sold me off of the eligible. I mean, the under 12 population is a population that is even in those. I forget who stated the numbers earlier. I don't know if it was somebody that called in or somebody that was on the panel that spoke earlier about when young kids do become affected or infected. 99% of the time, 99.9% of the time, it's sniffles and flu-like symptoms, no different than the influenza of the normal strain, the year-over-year influenza. So I'm of the opinion that the way it was written was the way it should remain.
I just want to add, I don't know if you can see the gallery view when I share my screen, but I can see the gallery view, and Katrina has her hand up. I don't know if you all can see that.
We can. Thank you.
Do you want to have her comment?
That's your call.
Please, Katrina, if you wouldn't mind commenting on that.
I just wanted to be very clear, so I had an exact proportion for you guys to make this decision off of. That we currently, among eligible individuals age 12 and older in our town, there's 83.8% are fully vaccinated. We have another 5.7 who are partially vaccinated and would presume to move into that category of fully vaccinated at some point soon, which is 89.5%. So we're well above the 80% for our eligible residents. So the question is if we want to include our entire population because they're part of our population. And I can run that real quick. So we have 70.
Can I just ask one question on the population? I mean, seems to be the argument or the logic behind including people who are not eligible for whatever reason is we have to represent the community as a whole. So following that line of logic, our community as a whole is everybody who's here during the day. It's not residents of the town. It's all the people who work here, all the people who travel through here. And in order to be consistent with that logic, wouldn't we have to incorporate that number somehow and get a handle on that? Otherwise, it's kind of imaginary. It's as if the only people who are in Littleton at any point in time are the people who live here. And that's true exactly 0% of the time.
So Paul, I've actually been keeping an eye on the vaccination rates in our area, and our numbers are very similar to our neighbors. So anyone who's coming from the surrounding area just around us has very similar vaccination rates as we do.
If they're coming from the areas around. So again, there's a lot of assumptions here, but that's okay. I just kind of want to know.
And I can also we can probably look at the state's number. I can probably pull up the vaccination rate for Middlesex County as well, if that's something of interest. I just need a minute to do that. So just to be clear, if you're including all residents, including those age 0 to 11 of Littleton, we're at 78.7%, at least one dose. So 73% are fully vaccinated, 5.7% are partially vaccinated, which totals 78.7%. So we're getting close to that 80% threshold. Let me look up Middlesex County for you for vaccination.
All right. You might want to take a gander at all the license plates at the point or at the gas stations in town too. I think we're a little beyond Middlesex County. Who's in,
I can do Worcester too if you want.
If we're going to stand behind this kind of numbers as if they have a credibility to them, then I think they need to have a credibility to them.
So I totally get that. I think these are the numbers that we have accessible and with which to make decisions.
Well, then that's a distinction we ought to be willing to make. I say that when we should be making that in writing, or so that we're not standing behind something that, has some inherent flaws in it.
But as has been pointed out before, these are not binding numbers. This is a criteria by which the Board of Health or both boards will make the decision to rescind, not this standard must be met. And if this is the best standard that we have to evaluate, I feel like we should use it.
Okay, good. So we're not going to bind ourselves to the criteria? Okay.
No,
all right.
It's optimal, not required.
Okay, so this is more jazz than classical music.
So we currently in Middlesex County have 77.1% of the eligible population fully vaccinated.
I got it. Yeah.
So we are slightly higher than that, actually.
Yeah.
Actually, quite a bit higher.
I'm not opposed to acting. I just have a visceral resistance to acting on a supposition that doesn't hold up. But I mean, I'm willing to take it on the more general notion that the problem is growing, it's morphing and growing, and while what we do in Littleton is probably not terribly significant in the big picture, it has justification on that basis. That, to my mind, is a more credible argument than basing it on some numbers that don't stand up too well.
And I'd just like to add again that it looks as if vaccination may not necessarily be an incredible, shall we say, stable kind of indicator over hopefully the short term, because until it's basically the people who've been vaccinated, who are part of the 79 to 80% of eligible being vaccinated, some of those are now undergoing, some percentage of them are now experiencing very, very likely a waning of protection. So they're vaccinated in name only, as it were, protected. They're vaccinated for sure, but in terms of transmission and all the rest, they're becoming vulnerable over time. I'm not trying to make this more complicated. I'm trying to say number A is probably the one that will, from a clinical point of view is very important. And B, retaining that would give us an opportunity to come to wrestle with trying to deal with, shall we say, the dynamics of vaccination and vaccination stability.
Chuck, if I may, Janet just texted me, and there's people with their hands raised. And unfortunately, we are done with public comment tonight, so.
Mr. Chair, if I may, I just have one other comment on this.
I'm okay with that. Mr. Flanagan, okay?
Yes.
If we can scroll up to the venue language at the beginning of the motion. The food service establishments and the indoor performance venues, I wanted to ask for the board's consideration of some language that would state that performers at indoor venues are not required to wear a mask if they can maintain a 6-foot distance from others.
I feel that's very reasonable.
Did you want to comment, Mike, or?
You're just playing with fire. I mean, it's, you know, it's risk. It's a risk. It happens to be one of the better places for the virus to spread, but I thought maybe Dan has, I mean, my experience with this is not, shall we say, exemplary, because I only get to see the horrific instances, but maybe Dan has a better key on this.
Dan, did you want to,
I mean, certainly the challenge is singing, particularly. I mean, it says performers, because that can mean a lot of different things, from a dance performance, which is potentially deep respiration and therefore increased aerosolization, but odds are going to be more than 6 feet away, is different than a singer standing in the corner of a coffee shop, you know, belting out a tune where they're aerosolizing into a much larger area than 6 feet. That's certainly kind of where we were last year with, you know, my son with his trumpet mask and bell cover and no choir, because they recognize deep respiration and, you know, aerosolizing behaviors such as loud singing, yelling, those things does increase that cone of infection, for lack of a better description. I'm concerned that, you know, certainly it's hard to sing with a mask on, but compared to spraying, you know, the front row with potential virus particles, is, I'm not sure if that's a balancing act that makes sense for in that place. If we're expecting it every place else, we now recognize an aerosolizing behavior and going, no, that's okay, because it's, I admit I'm concerned with that as far as from an infection control perspective.
Thanks, Dan.
So thank you for that, Dan and Mike. Do we have any data to support that venues with singers and public entertainment are more apt to spread the virus? Do we have contact tracing that's brought it back to those certain type of venues? I just know that there's establishments in Littleton that have planned to have singers and entertainment at their businesses, and this will just be another impediment to their ability to their livelihood, including the singers, who will now have something that they had scheduled that they were depending on canceled. I just was wondering if we had specific data to back up something like that.
I think Jim mentioned in contact tracing that some of the 17 cases were from somebody who had attended a concert, and that could be, you know, the Eagles concert at Fenway. I don't know, but.
So it could have been a large crowd type of situation, Lisa.
Yeah, outside though.
Tailgating, yeah, you never know.
Okay.
From a contact tracing piece, I'm not sure we have that data. Certainly from a, you know, a laboratory setting, looking at droplet spread from different behaviors. I don't have the citation in front of me, but those studies were done pretty aggressively and clearly, you know, back when we started looking at aerosolization from different performance type behaviors, that I can certainly go do a Google Scholar or a CINAHL search and be able to pull those up if you really want them. But that data is from a laboratory piece, has been done. It's out there. It's pretty clear.
Maybe I can help. There's the most recent one that's available with lots of references to different settings, is in a recent issue of Science. And the take-home message very simply is that aerosols are formed, especially on singing, regardless of the space. And the aerosol is, when I say aerosol, I'm talking about a particle that's 5 microns, that's 5 millimeters, 5 micrometers. You can't see it. The droplet is that size. They're not big drops. They're very small drops. And those are especially difficult to deal with because those are that size and smaller make a beeline for the lungs. And basically, it's very easy to transmit that. And with ours, you've got a very serious issue on your hands. It may take a couple of days to develop fully, but you're done for at least if you're vaccinated. The most you would avoid perhaps is either a brief hospital visit or none at all, but you begin transmitting. So I would strongly suggest that we, as much as I like the distance idea, from my exposure to these kind of data, I would suggest that we keep the masks on for singing, especially in the smaller venues.
So I appreciate that. I'm just trying to find some form of compromise here with our business community and other other establishments in Littleton with implementing something like this.
Yeah, this is one of the reasons I have difficulty with the board, the select board, emphasizing this particular aspect, because this is an issue of public, basically public health.
Right. Well, I mean, and to counterpoint that, Mike, our role as a select board is to look out for the well-being of the community, and that includes our business community and those establishments as well, for many reasons. So I appreciate that. Based on that, I have no further comments. It's clear that I feel like we're overreaching or overstepping. So I'm all set.
Would there be a way to ask performers to show proof of vaccination or a negative COVID test before they perform?
That would be up to the company, I believe. I don't think, if we start asking that kind of stuff.
We could put a mask mandate in place. Put a vaccination mandate in place.
I'm not. We're not discussing a vaccination.
Everybody know that Chuck DeCoste just in fact suggested a vaccine mandate for the town of Littleton.
And Dan, if you're going to call me out, call me by the right name, please.
Sorry. We do know that is in fact, unfortunately, within the scope of authority of the Board of Health to require vaccinations. Not that I'm suggesting it, but
that way.
Can we move? Are we done with number 3? Because I have another change request or comment.
Sure, Matthew.
Just to go and address the number 6, the fitness club. Mr. Keene made a pretty compelling argument that his establishment met some criteria that were, very satisfactory as far as reducing transmission, including, a clientele that is cultivated, appointment only. So I'm curious if we could add a sentence to that one, which would allow fitness centers to bypass the mandate, provided that they can prove to the health inspector or some other authority that they can, cover that their their establishment is equivalent to outdoors based on airflow and CO2, or that they can prove that their clientele are vaccinated.
We can, I just don't know how to word that. So I need somehow.
Okay.
I mean, quite clearly, if somebody comes in with a shall we say, a configuration that is basically outdoors in terms of air circulation, with the windows open as they do in the schools and HEPA filters and the whole, depends on how far you want to go. They're technically, quote, outdoors. We don't need to have that in there. They just establish, oh, I'm outdoors, Jim. Don't you agree? And if they are outdoors by outdoor criteria where they have the flow and all the rest.
Oh, so even sorry, if they're interior, but they have garage doors open, but they can demonstrate through airflow that they are essentially outdoors, that then they will not be required to have their clientele mask. Is that what you're saying?
Well, we have windows open in the schools, right?
I just want to be 100% clear that that's a possibility, because that would definitely solve probably the biggest issue I have with this right now.
So it's about air exchange, CFM.
Yeah.
And although, you know, there are less expensive ones, but there are CO2 parts per whatever uses a very good criteria, inexpensive monitoring. And I'm fairly confident, and Jim can contradict me at will, of course, that if folks are, if a business owner checks his clientele and finds out by his own methods or her own methods that they all are vaccinated and the garage door is open and they got airflow, they're outside.
So could that apply to certain restaurants and other establishments that are having entertainment?
If it's technically outside, if they're meeting the flow, I mean, it's going to be hard to do for a lot of the, you know, the establishments I've been in around Littleton, but you know, who knows?
That whole open wall.
Unless it's outdoor entertainment or on the patio. But I just want to be 100% clear, like they would not have to apply for an exemption. They would simply have to ensure that they're meeting the standards if they were inspected. Is that accurate?
That's the way I see it.
I would just call it indoor fitness centers and leave it at that.
That's a good compromise.
Thank you, Kevin.
Can we go
Great.
back to paragraph 3 and look at that language based on this? Okay, so we left that in there. All right. So we're okay with that?
Number 3, I think the performers who need to maintain 6 feet should probably go away.
But based on what we just discussed about the fitness centers, what if it depends on the venue?
It's outdoor. That's fine.
If it's
So
outdoors, but indoors, I think we need to be consistent that indoors is a mask, basically with very few exceptions, or that we develop, rather than trying to each line, each piece, try to come up with some exclusionary criteria if they meet this, that, and the other thing. If we can come up with either a global exemption criteria, and that simply can apply for, you know, basically a variance or a variance equivalent with the Board of Health, or if the board chooses to empower the health agent to grant them, but we have to come up with some clear, reasonable, and consistent criteria across a variety of buildings, facilities, and venues. That would be my concern with going that route. Make sure that we are fair and equal with everybody. But try and do this, okay, so venue performances are okay and fitness centers are, but something else isn't. That's hard. Now we're starting to get, and we can bounce this back to Attorney Rubin going, this venue gets exceptions, that company doesn't. We're making this a lot harder both for ourselves, but also for the residents and for the companies going, what's fair?
Did Mike not just suggest the standard was that it was equivalent to outdoor? I think he did.
He did.
Okay, do we make that a line item then? Add a new line item that, you know, if a facility, building, whatever catch-all we want to use, can demonstrate to the satisfaction of the Board of Health and the health agent that it is airflow, distancing, air exchange is equivalent to being exterior, then they can request a variance requirement.
What if the performer had a plexiglass screen?
No, they don't work.
Chuck, that's the standard. I think at least it was when they were, you know,
those plexiglass things to turn out not to be too good against. They don't work that well against the aerosols that Dan was just mentioning. For shall we say, for long periods of time being more than 15, 20 minutes of spouting.
do they break down or how is that so?
It has to do with airflow. I have not mastered the equations and I don't want to. So what I can tell you is that it's good for a few minutes if you're, doing a quick transaction, but
the town clerk's office or something like that.
Yeah. But yeah, I'm sorry. It would be great, but the thing is not a complete enclosure. I mean, it's not worth going into. I don't want to board Chuck. I can't do that.
No, I'm on board, Mike. I'm thinking if we had a 6-foot space and there was a screen in front of the performer, I'm just thinking it's the whole Swiss cheese thing, right? It's just another layer.
Well, frankly, if the performer wants to perform in this environment, I think the mask, a double mask probably beats it just about everything we've mentioned here tonight. A double mask really works well. It does not, if you have the right kind, the aerosols are basically cut to the point where if you have over a meter, 3 feet or so between you and the person, the plume is greatly reduced. So I think the mask wins.
So I'm drafting a section 12 that is going to have to be very much modified by all of you because I'm trying to draft it on the fly.
I would just leave it as they can apply for a variance and not put any specific language as to what exactly.
I feel like there needs to be some criteria for the variance that has to do with the indoor-outdoor flow. Because then otherwise, like, what are we basing the variance on? It starts to get a little arbitrary, and that's my concern. I just don't know how to phrase this indoor airflow exchange equivalency properly. So
because you can't quantify it, you have to quantify it, right?
Or by criteria established by the Board of Health or its agent is equivalent to. I apologize for drafting this on the fly like this. It's awkward for everyone.
That's why you're here.
Something like that. I mean, feel free to tear it apart.
Would you want to add CO2 as well? I think someone mentioned that was a very good indicator in addition to airflow.
Yeah. Can I make a suggestion since I'm one of the people causing all the trouble here?
Yep.
And I don't want to push it too much, but I think it's time for the Board of Health to recognize the fact that we probably need some expert help in shall we say, in looking at outdoor airflow indoors. Okay. So I would suggest that the wording that you're putting up here gives the Board of Health an opportunity to do some homework after we make a decision about this particular mandate.
Okay.
We do it. In other words, and if we can't do it, we can report back and basically not have it. So I
mean, just because someone applies for a variance doesn't mean you need to grant it. You just need to set the criteria. So let me just think for a minute about how to state that.
And I apologize to all of you for bringing this up.
What about that?
Um, what limit I know about carbon dioxide, it's not exchange level. It's actually the carbon dioxide levels in that space. Exchange refers to the CO2 going back and forth between people. That's wonderful, but it's actually it's a fair criteria to use how much CO2 is in the room. That if it goes above a certain level, it becomes by these criteria that you have a problem.
You add something like similar to levels out, in an outside setting, because we're talking about indoors and outdoors.
Well, the idea is to maintain a space that's about 1,000 parts per, I forget, I'm out of my depth here. It's 1,000 parts per million, I think, of CO2 is just about the point where anything above that, you probably should either open a window or do something really quick. That's considered to be at the level where it's not the carbon dioxide. The carbon dioxide is a measure of the airflow, of the stuffiness, I'll call it.
I think that reads well and it's broad enough.
Madam Chair, can I just make one suggestion?
Yes, Jim.
On that 12, just to take out or its agent, because you're really the authority, so it really shouldn't be me making that determination. Yeah.
Does that look okay to everybody?
Mm-hmm.
And were there any other adjustments? I think that we have to get to the.
So I just want to clarify. So now that we have this section 12, do I need to make any modifications to 6 or 3?
You were taking out the.
Because we have made some distinctions about clarifying that it's indoor.
Perhaps you could just remove that indoor because now it
This
will
indoor.
be covered by 12.
So we're going back to just fitness centers.
I think so.
Okay. Oops. That's okay. And then what are we doing with, are we making changes to this performers line, or is that staying?
I think we take that out and they apply for the variance, just showing that the venue can meet the outdoor airflow, right?
It specifies in there that's number 3. It says indoor performance. So that's it.
Performance.
Yeah, I think that we have number 3. It's indoor performance. We make it very clear it's indoor performance. And I'd like to I suggest that we leave that wording in, because the one we just mentioned is basically opens the, shall we say, the ability to seek a variance.
So you're saying in number 3 that they would not be able to seek a variance, Mike?
No, nothing would stop anybody from, as far as I can make out. Number 3 basically says if you have an indoor performance, performers at indoor who maintain at least 6 feet distance, as far as I could understand, did not satisfy the criterion we're trying to establish, which is is to prevent, shall we say, spread. So the distance doesn't do it. It's the mask that we're trying to get at here. And I'm suggesting that would not be, in my view, not useful for the venue mentioned. Indoor performance venue.
So should I remove this entire performers and indoor performance line?
Yes, that is my proposal.
So that way they can apply for a variance.
Yes.
Does the whole board feel that way?
I think it would be hard for performers to sing probably with masks, but I know that it's safer. So,
Yeah.
and yeah, I suppose. requesting a variance would be a compromise.
Probably the safest way.
Are you going to add that, Alexandra, to that? That a
I'm sorry,
variance?
I thought that
12 covered it.
appeared here.
Okay.
I will say that this is going to make it incumbent on the Board of Health to get its criteria in relatively short order. I just want to put that out there.
Lisa, Ed Mullen has his hand up.
Go ahead, Mr. Mullen.
Thank you, Madam Chair. American Society of Heating, Refrigeration, Air Conditioning Engineers, otherwise known as ASHRAE, they provide guidance for building remaining open and providing outdoor air quality to remain open in those scenarios. I can provide that to the board and or to Attorney Rubin for clarification on definition of outdoor air quality.
And is there some, so if we have this criteria, who tests it? Would that be Jim would do that, or is there like that organization that you just said?
It should probably be tested by a registered design professional in the design for heating, ventilation, and air conditioning to test and tell you what the air quality is. So if somebody wanted to, let's say, a fitness place wanted to open and they were willing to, I don't know what the fee would be, but spend the money on a design professional to quantify the air quality and then allow them to apply for a variance as being proposed would be one opportunity.
Are the schools using them? Or did they?
The schools are using the state criteria, which is, ventilate, open windows, the exhaust systems that they've installed, draw in fresh air, and they also have air filter mechanisms inside the classrooms, just like town hall. All our HVAC systems draw from the outside. We don't reclaim the air at this time. It's a very long list. It talks about system evaluation, inspection and maintenance, ventilation and filtration, building readiness plan, occupancy flush and outdoor air pre and post, modes of operation for the building, etc. It's a deep dive into if you're really going to, mandate outdoor air quality for indoor spaces.
Anybody have comments on that at all?
If I may, Madam Chair, how is this going to affect the schools, the bands, the choir?
Plumbing arts.
I think they're all wearing masks anyway.
Yep.
The,
October 1st.
So what
there's no band practice or anything?
what I've highlighted is just that nothing in this order essentially applies to schools. We're going to leave that to
okay.
Desi and the commissioner.
Okay, gotcha.
Commissioner Desi.
All right, thanks.
One of the major reasons that we're looking at this, make no mistake, is to prevent community spread, that is town spread, so that the various mechanisms in place of the schools won't have to bear an undue burden.
Okay,
So-
shall we? Thanks, Mike. Should we move on? Does anybody have any other issues with the draft?
I think Kevin Baker had made a proposal based upon the date.
Yep.
In his earlier comments.
Yeah, I just mentioned November 1st.
Reevaluate it November.
Oh,
Yeah, that's a pet chapter 13, paragraph 13.
Now 14.
Oh, now 14, yeah.
Okay, November?
November 1st, or do you want to mirror what the schools are doing, Kevin?
That's in October though, isn't it?
October 1st.
No, ours says on or before November 1st, number 14.
Mm-hmm.
That would just be a month. Would that be enough to show any? Well, I guess it can always go up, right?
Or maybe the school, maybe the school will, in order to solve a problem in the schools, they may just leave it up to the Board of Health and incorporate this, by transition into the schools as well. In other words, the mask mandate will continue in the schools beyond October the 1st.
Yeah, I would say November 1st. I would give us enough time to.
Yeah, I think November the 1st, we should be able to have a pretty good idea of where we're heading, or at least a guess of what we're heading, better shape than we're in now.
And it says on or before. So if you see Delta trends start going much downward, and you see that, you're heading in a really good direction, there's nothing that says that you can't do it, much sooner than November 1st.
Yeah.
And just so everyone sees, based on some previous discussion, I deleted the joint select board review and the joint select board discussion for rescission, and left it only to the Board of Health. So I just want to make clear that everybody sees that change.
Yep.
Okay. I don't want anybody to think I'm taking away their authority.
Select board, okay with that? Members of the select board?
Sorry, I put my thumb up. Yes, I'm okay with that.
I can't see your thumb, Matthew.
It's huge.
Ms. Napoli?
Sure.
Mr. Glavy still here?
Yeah, I'm not going to quibble over the details of this proposed regulation because I, as a general matter, support, even if it's not clear in statute in all cases, I generally support deferring to the Board of Health on matters of public health. And by participating in the detailed discussion of this proposal, I think I might suggest that I support it in its written language, and I don't, but I will support the Board of Health's right to enforce it. So,
but as far as being able to rescind it, if we had all of a sudden COVID went away on.
Well, I was trying to say, I'm clearly, my position is defer to the Board of Health on this. And, I tried to have impact earlier in questions, and it was clear that at that time that this is pretty much a done deal. So we can make changes around the fringes of this thing, but it's teed up and ready to go, and that's whatever final form it takes along those lines is fine with me in that context.
Okay.
So why don't we do this? I'll bring it to the top, and everybody tell me you're done reading, just so everyone can do a final read through. To the extent that there's no further discussion. I'm not trying to rush anybody.
Have you accepted the changes? Not yet, right?
I haven't accepted anything. No.
All right, good. Just to be able to see the kind of the before and after, Mike. Stop laughing at me.
I'm not laughing at you. I'm just, please, no. It's not laughing at all.
You waiting for us all to say we're done?
Yeah.
So if this is voted upon tonight by both boards, it goes into effect right away. But if it is not, we can say it starts anytime.
Yeah, you can say
Oh.
that I have effective essentially Wednesday.
First, that's tomorrow, isn't it? Or 2 days?
Wednesday.
From- Okay.
2 days.
So,
We
in
can
order,
change that date. You can do
Yeah.
it
in
immediately.
order, to, in order to make it easier for people to, as we said earlier today, train their staff and get some notice. I was thinking that maybe we push it off a few days until, like what Boston did, they started theirs this weekend.
I can
So
say Friday.
If we could say that it starts, on Sunday night at midnight, give people a little bit of chance to figure out what they're doing.
Kind of follow Boston's 7-day. When they imposed, Lisa, that's your thought.
Right. So we'll need to write up signs and, just put them out and, answer any questions too.
I also suggest that the Board of Health be clear on the criteria for the indoor-outdoor situation. The way that they're going to be granting variances or not. In that time period.
So, Alex, and so if there isn't any clarity on the granting of variances, is it like the ZBA where if someone were scheduled to have a performer the Saturday after September 6th and they applied to come in, how does that get handled if there is no criteria?
If there's no criteria, then they're subject to the mandate. So the idea is
They
that
don't get to perform by right like a zoning board of,
yeah, no, so they're applying to the board for an
to get
exception
relief.
based on this criteria that the board's going to need to set. Which sounds like it can be based on, it sounds like you have at least a jumping off point.
But it also sounds like, based upon Mr. Mullins' comments, that they have to spend money to get an evaluation done by a professional. So the whole purpose of it,
That's something that they need to decide.
the venue has to determine that they're trying to have a performer in there so they can stay open. But now they have to spend more money to see if they can get a variance to be able to even have the performer come in to bring people in to keep the doors open.
The Board of Health can decide what the specific criteria are. They can decide to adopt every one of the standards that Mr. Mullen referred to, or some subset of them, if they feel that a subset is going to be effective.
I'd like to suggest something here that, for simplicity and to get started on a firm footing, I hate to go back in time, but wouldn't it be useful at this point in time that we first basically go back to the original version where we had performers having to wear masks to perform? Okay? And get the feedback and get the response of the people who are controlling the venue, including when as appropriate. Get that feedback from those folks who feel especially, shall we say, disadvantaged as a result of it. And for the Board of Health, which you can still do a different formulation. Because at the moment, it seems to be unrealistic and maybe a larger burden than simply having, at the beginning at least, a mask mandate.
What did performers do before? Did they sing with masks on? I haven't seen any.
Yeah, at the top of the surge, they had masks on and they were required to be 6 feet away.
I think it was more like 20 feet.
Yeah, for places of worship and things of this, it turned out to be a real, shall we say, dangerous place to be and then very impractical for singing. Okay, so the result of that is people started wearing masks and staying 6 feet away as the surge dropped away.
I admit I'm confused now. So what Mike just said versus what Attorney Rubin just put back in to the draft, basically she added 6 feet back and took out masks for during performance.
Right. Yeah. And I don't mean to get the discussion started again, but it seems to me having a mask in there accomplishes what we're trying to accomplish, which is to reduce spread and do a minimum amount of inconvenience and, shall we say, torture to the owners of such places. This seems to be far simpler than spending money on engineers and all the rest when we're not sure at this point how needed that might be.
Mike, hit record. I agree with Mike.
This is the third or fourth time you've done this, Chuck. And
Well,
This is awesome.
To Dan's
No,
point,
we're all in this together.
I think I'm confused
I
as
agree.
to what it is that you want me, how you want me to alter paragraph 3.
so alter that paragraph so that the performer has to wear a mask. Am I right, Board of Health?
Correct.
I think that's where Mike was going, and yeah, I think most of us are kind of on board. It's clean, it's simple, and it accomplishes the goal. And then we can always revisit it if we need to, if it creates an undue hardship.
And then what are you suggesting? Go back to just saying indoor fitness center and then eliminate number 12 altogether? So no variances, this is it. No one has to calculate their CFM, so it's outdoor air quality inside. And this is the deal.
Yeah, people are lucky enough to have garage doors that they open to the outside. Basically, I'm not trying to invent an exception here, but becomes, are you indoors or you're outdoors? They could make the case that they're outdoors. Leave me alone.
I think keeping the variance language in there is still perfectly fine. I think this addresses the performer piece, which is has a research-based rationale.
Right.
Keep the variance piece in for, only because Justin, had spoken. We'll use Woodshed as the example that if he and his folks can demonstrate, our criteria that it meets, it meets the criteria, or it certainly it warrants a variance, then that's still an option. And the variance language is still there. We can still grant it for anything we feel is appropriate, but it addresses the performer piece. It also keeps some flexibility for those businesses who are able to request a variance and meet that criteria. I think that's a pretty good balance between the business community and the public health side.
Do you want me to add indoor back to fitness center? So the idea is that if you're indoors, you wear the facial covering.
Yep.
And if you're out in the middle of Fay Park doing Tai Chi, then there's really, as long as you're distance, that should be perfectly fine.
I also changed it to go into effect on Monday, September 6th. So that gives a week.
Give me some water.
You scroll down a little bit, please.
I had used the word establishment earlier. This is just my own thing. Is anybody bothered by that change?
Oh, that's better. Can you scroll down a little bit, please?
I think it was number 12 we were trying to not get into. Is that right, Chuck?
I believe so, Mike.
Yeah.
Okay, so somebody shout out how you want me to alter 12.
I'm sorry, go ahead, Chuck, please.
I was just going to say that if we're using the Woodshed as an example, they're able to demonstrate carbon dioxide. They already record it. So as part of it's one of the features that they offer their members, the air quality.
So how would you suggest changing that paragraph?
I think the Board of Health will certainly have to come up with basically a list of conditions, a list of standard conditions to go along with the variance. Because even outdoors, we can still, if there's no mask, you're inside a building with outdoor air quality. There's still, I don't want folks sitting around, having a little cuddle puddle. It's probably not going to accomplish our goal. So we need to come up with a set of standard criteria going, okay, so you have outdoor air quality, but you still expect it to be, you can be maskless, but still maintain distancing and those kind of pieces that even inside a building with outdoor air quality, if I'm within 2 or 3 feet of you unmasked, I'm still going to be providing a potential vector. But that's something that certainly the Board of Health can come up with as standard conditions to go along with that variant, just to clarify. We still expect or, request distances, whenever possible, and those pieces that standard, hygiene practice kind of stuff.
So
I just edited number 12, so read it. If everybody could just take another look at it. I tried to simplify it. I don't know if I was successful.
So just say may apply for a variance from the Board of Health.
Mr. Chair, if I may, didn't Mr. Mullen have a recommendation of a resource to make this determination?
It was a standards, not a resource. But yes, he had a list of criteria that would be a suggested criteria
That the Board of Health could rely on.
Yeah.
Alex, can you move your cursor?
Can you just take out indoor air quality and just say meet criteria as determined by the Board of Health?
Meet air quality criteria.
Meet air quality criteria.
I would just say meet criteria.
Yeah, get rid of indoor air quality altogether. So that variance could apply to any one of the
distancing
visions.
Yeah.
I think what we're doing right here is opening the door to keeping the Board of Health and whoever very busy for lots of times. And that's not the idea here. The idea here was originally to try to help businesses and yet do public health. And I'm getting concerned that in our effort to try to accommodate, we're setting up a difficult situation for everyone.
And delete number 12.
Yeah, I would say just take 12 out. And we should just, shall we say, put in the if we can agree to everything else, put in the order. And if people come in and start saying, look, I'm getting killed on this, what can we do? I think the Board of Health should respond and be in a position to respond given the developing situation. Our first job is to reduce transmission, and we're trying to do that. And I think that the mask mandate probably won't change things as much as we would like, but let's not do number 12. I'm suggesting we just take it out.
I'd agree.
My finger's hovering over the delete board.
So how is any business owner going to know that they can, if this isn't in there, that they can approach the Board of Health and at your basically, at your pleasure, be allowed or denied a waiver from this mandate without any structure at all? It appears that you're opening yourself up even more for like indeterminate requests for random changes.
Well, that's one of the reasons. I'm sorry, Matt. Maybe it's too late for me, but I feel number 12 basically opens the door too widely to transmission, and basically opportunities for, shall we say, uneven application of that effort. I'm suggesting the removal of 12 means there's going to be little or no opportunity for changing.
But the Board of Health has the final say, Mike.
Yep, I understand the final say, but
we had people coming to us during the height of everything with their plans.
Right.
At our meetings, the book fairs and the plant.
Looking for relief.
Yeah, without relief, but also checks whether or not they can do it.
Yeah, they Park and Rec, with Santa in the back of the pickup truck. They came to us and explained to us what they were doing. Each time they had a question, and we made suggestions and made compromises, and everything, the book sales were able to continue to happen, and the flower sales, and
Up to you guys.
Do you want the variance to be based on air quality, or do you want it to be more broad?
I think Mike's suggesting that it get removed, 12 get removed altogether.
I agree with that. People will come to us when they need something.
That's Alex's favorite button.
No, and I have to retype it again because you changed your mind.
And I hate to open up this can of worms, but if we're basing the level of community transmission from the data from Middlesex County, shouldn't we be basing the vaccination rate on Middlesex County?
It's a different criteria, though, right?
It's a different criteria.
It's multi-level.
And I think Katrina mentioned that the vaccination rates were and transmission rates were pretty equivalent.
Mm-hmm.
And again, I'll just highlight that it's optimal criteria for the basis of a determination. It's not binding on anybody.
Okay.
And 13B is total, not eligible.
And if it's optimal criteria, shouldn't it be an and not a and or?
Not necessarily, right?
Well, if it's
No, it needs to be an and or. I think we get into the weeds with and.
That was
which is if it's optimal, then and.
All right.
If we have a
Sorry.
great vaccination rate, but still an incredibly high case rate, then just because we're vaccinated, but our cases are crazy high, then we still have obviously an issue that needs intervention, which would be an and. If it was an or, then we could say, well, we're 95% vaccinated, but we've got 100 cases per 100,000. But by this criteria, we have met our optimal criteria to withdraw the order. Obviously, I don't think we'd be there with that. I think it's an and. We want to be vaccinated and we want low transmission. It's a pair, it's a set.
That's optimal.
Right.
So if it's optimal, then it should be eligible population.
No, optimal is total population because total population is a vector.
Disagree.
Chuck, the virus doesn't agree. Sorry, the virus doesn't.
It's fuzzy math to me.
Okay.
didn't they say we're almost at 80% anyway? We're fully vaccinated?
Yeah, we're very close, and our vaccination rate doesn't necessarily ever going to go down,
right?
Unless we suddenly grow. Suddenly, lots of people start moving in.
The last set of data from the state, we're at 73% total population vaccination rate. We're at 79% had at least one dose. So hopefully all those folks who've had one dose of Moderna or Pfizer will in fact go back and get their second dose. Although there is some drop off, they don't always do that. But we are almost at that 80% and our numbers are going up, which kind of speaks back to that. And we're almost at 80% having one dose. So we're getting there, but our numbers are still going up. That's kind of that looking at the optimum piece. It's a set. We want numbers going down and we want high vaccination. It's a set.
One more Vax bus trip and we got this.
Yep.
The Vax bus at the Oktoberfest. That'll put us over the edge.
So that the percentage stays the same with total population as it would with, because we had it 80% of eligible. So that doesn't slide with total.
Not if we're looking at optimal.
All right, you already lost me, so.
Yeah, it's funny. Everything that select board suggested has been removed from this. So
At number 12 with the $300 per violation, I think should be removed as well. I can see you putting some teeth in there, but
I agree
breezed
with
right
you.
over that.
Chuck.
yeah,
What's
I
that?
don't.
We just
Remove
jumped right
that.
over it.
Oh, right.
I agree with you, Chuck.
Thank you,
Chuck,
Gino.
Chuck, could you, since you're taking it out, could you suggest something that would work?
After verbal communication and written warning.
Yeah.
Even if we take this out, this would still be an order that would fall under, and this is actually probably for Alex, this would still be an order. Would it still be under the 21D fine schedule, even if it's not listed here? It's not a regulation, so it would not fall under a Board of Health regulation and therefore meet that criteria. I don't know how an order would work if that would fall under that town rules and regs piece for whether it's listed here or not, if it would fall under that.
So let me just, I don't think I can double screen share. But the section 1-4 of the code states that, let me find it. The non-criminal, so essentially 21D may be used for violations of any rule or regulation of any officer, board, department, which is subject to a specific penalty. So the statute subjects it to a specific penalty. I believe that this would fall within section 1.4 without having to specifically state it, although I am more comfortable stating it. If the plan is to do education, then warning, then fine, I would rather it be in there than not. So I think the conversation is more, are you looking to actually find people, or are you looking to use this as an education? I'll say that the majority of these orders, as I've seen them more recently, don't have anything about 21D or fining. It seems like, they're just orders but essentially with an educational purpose. Some of them specifically say that they're not fining and it's for an educational purpose, but I have seen a number that reference 21D or the various 21D-ish code sections. So I feel like if it's the will of the boards to have some sort of fine enforcement structure, then keep it in.
It also says may,
Mhm.
it may fine them, not shall. So it's at your discretion, ultimately.
What did the other 15 communities in Middlesex County put in there?
They don't have it.
I know Belmont doesn't have it. There's no fine in there.
How are you going to find somebody?
There's nobody to enforce it. So I mean, Paul made the point that it's kind of, if it's just for education, it's just for education. But I mean, we've now gone with
You're
3
going to ask
hours.
them for their license at Market Basket and send them a fine? I don't get how we're going to
Well,
enforce
the
that.
establishments get fined.
I think it matters more. I think 3 times, I'm being optimistic here. After verbal education, written warnings, we could make the fine, a low one with the idea that the funds would be used for other purposes. So I'd like to see a dollar figure in there only to give some symbol of teeth to this. I mean, I'm more interested, very frankly, in people doing what they have been doing up to this point, and that's proceeding to keep themselves and others safe. And I have a feeling that $300 here is basically a little aggressive, but that's just, I only proposed it looking for discussion. So I want to suggest that we drop that to $50 per violation and make it slightly more palatable. But this would be after verbal education, and the proviso is may. It's not much of a tooth, but it's better than zip.
Madam Chair, as the person who probably will be doing some of this enforcement, I was just wondering if I could get some clarification on it myself.
Okay.
So as we're going through this in section 8, it talks about establishments, and then it says, I don't know if we can go back up to it. I just want the second sentence, the words are a little different as we talk about that. So I just want to so it says establishments there. And I think the second sentence actually says, businesses shall supervise and enforce. So whether that's,
I should stay establishments too.
And again, the language is important when you're doing enforcement. So, and then if we go down to that, it would be easier to, and I don't mean the word easier, it would be more systematic, if you will, to do enforcement on an establishment than on an individual. I'm more likely to remember the establishment that isn't complying than any individual that isn't complying. So if you're looking at how many times somebody's not paying attention to the mask mandate, it's a little more difficult with individual than it is establishment. So again, it's more for discussion and kind of the functional application of this.
It also reflects, does it not, Jim, your experience and our experience in the past year or so?
Well, and again, what I mentioned, the experience so far has been the establishments have been extremely good at or the compliance. So a combination of both the citizens and the establishments have been very good at compliance.
Great, thank you, Jim.
Thanks, Jim.
Yep.
So I modified number 12 a little bit just for your review.
I like it.
Looks good.
Thanks, Jim. Thanks, Chuck.
I don't like it. That's okay.
I'm still hung up on that and/or.
I agree with you, Chuck, but
I mean, yeah, I understand it's optimal criteria, but the and/or, I mean, if we're at 0% transmission and 79% of total population and 95% of eligible population, I just don't,
should be erase it. Just take it out of there.
I think it's
it introduces common sense. You guys can make that determination with the and/or in there.
it gives flexibility.
Yeah, I mean, again, it was just referring to the optimal criteria. So
This still refers to the optimal criteria.
The advantage of the and is that it basically gives shall we say, a target for the town to look for getting fully vaccinated. The advantage of that is that, first of all, we have the flexibility built into the number 13. And we also have preserved the target that we're trying to reach for the town in order to make sure that we reduce transmission.
But we could be at 100% of eligible, Mike, and not be at the total population.
Right, which would indicate, yes, correct.
We 0% transmission. We could be
If we have no cases in town for n number of weeks or whatever we have decided here, okay, basically there is no reason to have we basically have hit our mark. We've
Why not put the or in there?
Yep.
Why not put the or in there?
Right.
Because we're not there yet. We're not at the point where we have enough vaccination where we can.
So there really wasn't any need for us to be here tonight then.
Excuse me?
The suggestions that have been made by the select board, the executive board in the town. There's none of it's been, I mean, try to bring the voice of the people forward and it's not being heard.
Okay. Unlike some other things that we do, okay, your suggestion for this is to have and or.
Correct.
Is that and or? Okay. So basically the and or means that we could hit little or no transmission without reaching full vaccination. That's one
For the total population.
For the total population.
Correct.
We could also have total population reach vaccination, and we may not hit, we basically are still have cases that are going on that prevent us from rescinding.
Where do you come from?
Right. And you guys could make that determination based upon the criteria.
I got it. Okay. So it sounds good to me because this solves the problem that we're trying to reach, which to reduce transmission, and gives the Board of Health and others in town an opportunity to reflect on what's going on.
Correct.
So I'd like to hear from Dan and Kevin and Lisa, please.
Gino.
And Gino already says he doesn't like me, so it doesn't like this.
Gino likes to have it, take it off, that's it. Take
I mean,
it
I'll
off
ask-
for $50.
I'll ask our
Yeah.
council if it's going to be and or, it might as well just be or. Correct?
Correct.
Okay.
I guess my question is that if we are already very high in vaccinations, do we need that? B.
We don't need that. We can
I think it's important.
pass it for later, not now.
I think it'll help people keep trying to get vaccinated, which will be good.
I agree. Yeah,
Yeah.
we're close.
Bogey out there.
If I may, Mr. Chair, I like the and/or just because it kind of gives a solidified message that there's two criteria that we're trying to make, not one or the other, but both in some respects.
Although our attorney just said that and or means or.
Right, but I
It
think just
means or, but optically, if you
Yeah.
optically,
Perception
right,
is
if people
everything,
read that, they're going to be like, hey, we meant A,
Yep.
we don't need to worry about B.
Yep.
But with the and in there, it gives you it sends the message that, no, we're looking to meet both criteria.
I liked Cindy's suggestion.
Let's do it.
I like sending crystal clear message. Nice. Thank you, Cindy.
You're welcome.
the and or has returned. Do we want to take another peek at the entire order? We can
I'm okay.
scroll up.
I'm good.
Again, or-
No.
No. Okay.
Is that the end of it? Is 15 the end of it?
Yeah.
Okay.
You want to add one, Matthew?
Not really.
Oh, boy.
Okay, so discussion over. No discussion? So is this where I call for a roll call vote? We all discussed?
I think that you can find out what the pleasure of your board is, and then
Okay.
we can.
So I'd just like to see what the pleasure of the Board of Health is on this motion.
You get my yes if you can take the $50 out of there.
Was there actually a motion made?
I think there should be a motion to adopt the order as
Well,
discussed.
so that's that. Lisa's actually polling the board and asking what their pleasure is. So this.
My pleasure is to have a motion for the Board of Health to consider the order as presented and edited by Alexander Rubin.
Second.
And any additional discussion?
Yeah, I gave you discussion. I gave you the yes if you can take the $50 off. There's no reason to do that. We're doing fine without it.
we're just trying to make people have, like they've said before, some kind of teeth in this, Gino, so that people will take it seriously. Do you think $25 would be better? Would you accept that?
Because who's going to be penalized is that the company, not the individual. Put $25 so and then we'll see what happens. But $50 is not reason. They got enough trouble without increasing other bills for crying out loud.
That sound okay to everybody?
Not for me. We're in the business where
I know.
is our
You're
responsibility.
You're
We
not
have a
in
certain
business.
responsibility to prevent. And I think $25 at $25 for an establishment, I don't think the signal in the 21st century is as clear.
Okay.
So to me, $50 is, oh, that's what it is. Well, okay.
I'm just trying to, take into consideration what Gino is saying, Mike.
I understand.
Okay, so we have a motion and a second. So we'll do a roll call vote. Is this right?
Correct.
So Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
You got to put a 25. I say yes.
Still at 50, Gino. It says up to 50 though, Gino.
right, we could make it $1 if we wanted to.
Okay. If we can do that, that means it's not stable, the 50.
Up to $50 per violation.
Well, all right, we'll see what happens. All right, I'll give you the yes. If we can make sure we can take care of it.
Okay, Dan Kane,
Dan Kane, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Lisa Flanagan, yes.
Oh, boy.
Okay, so if I could take the floor, Madam Chair.
Mm-hmm.
Any further discussion from the select board?
I'll speak when there's a motion, if you don't mind.
I don't mind at all. So we've got something before us. We can make a motion to act upon this motion, this order as the Board of Health just did. We can take a motion to do nothing. We can take a motion to adjourn. What is the pleasure of the board?
I move that we vote to approve this order as written.
I will second that for discussion purposes.
Motion has been made by Mr. Nordhaus, seconded by Mr. Glavy. You said for discussion purposes, Mr. Glavy, you've expressed an interest in some discussion, so I'd offer you the floor.
Yeah, it's more reiterative, so I'm not going to go into much detail. Although this is a very troubling hearing tonight, watching how this thing came to be, I still stand by my belief that the Board of Health should be deferred to, and when they determine interest of public health, and taking a very broad interpretation of that, I would reluctantly support the message. That being said, I don't want it to be interpreted, but by any means, I feel that this will make any legitimate headway against a very serious issue, and I would much rather we devote our resources to issues like returning all town boards to Zoom meetings, so that we don't create problems. Set a good example, have town hall be completely masked up, engage on an active campaign to get our vaccination rate locally up to 90%, things that people can rally around in a positive manner. And instead, we've unearthed this bureaucratic nightmare, which, as bad as it sounds tonight, it's only going to get worse in its implementation, and it's going to foster a lot of bad attitude out there. So I tried to make my points earlier to affect that, but it didn't seem that that was going anywhere. So I hope everybody will be open-minded to making changes later on if this doesn't work out as some think it will.
Thank you, Mr. Glavy. Ms. Napoli?
Maybe.
Mr. Nordhaus, Mr. Napoli, comments?
I would agree with Mr. Glavy that we should defer to the Board of Health, and I'm not sure the Select Board should have been involved in this. I do support the motion.
Ms. Napoli, comments?
Certainly, thank you. I appreciate the comments made by Mr. Glavy. I have many questions, and I have a lot of apprehension about this in general. I'm not happy about the impact this is going to have on our business community. I wish we could have found more of a middle ground and tried to maybe implement some of the recommendations made by Mr. Glavy. That being said, I do respect the Board of Health and that they are the authority for the health of the town of Littleton. That was made abundantly clear this evening by many comments. And for that reason, as a select board member, I can't support this. I don't vote to approve it or support it.
Haven't called the vote yet, but thank you. Although I do share much of your comments as well. I appreciate everybody taking the time and the effort. I said earlier that, you know, everyone certainly is passionate and everybody wants to do what is the best for our community. And I mean that on a larger scale, but certainly we're responsible for taking care of Littleton to that end. And to kind of piggyback on some of what Paul said, in the future, perhaps we could engage with something that I'm not sure if it's ever been done before, but maybe we could engage with the chair of our Board of Health, meeting with chairs of other boards of health in the community, in the surrounding communities, as if we're going to talk on that level, and that we're going to have the kind of influence and impact across town lines, try to get in alignment with some of the other communities. I still support what the governor has stated as recently as noontime today. And, you know, he's got a lot more resources than I do personally, or I think any of us have available to us to make a decision to put a mask mandate in place for Littleton. I would have been supportive of doing something, like what Mr. Glavy said with the masks in town hall and going fully back to Zoom and things like that. But I have too many reservations about putting this mandate in place. I don't think that we need to be, the numbers that I have are 15 across the state, not 50 across the state. There's definitely not 15 in Middlesex County, as has been discussed tonight. If there are, I'd love to get that data. I'd love to see that information. But I think that we can be a leader and do the right things by doing some of the things that Mr. Glavy said and you know, focus on being a leader by having vaccination rates that are higher than other communities and you know, just helping educate our community and beyond. So that being said, I will ask to call the vote, and it is a roll call vote. Mr. Nordhaus.
Mr. Nordhaus, yes.
Mr. Glavy.
Yes.
Ms. Napoli.
No.
And Mr. DeCosta is a no. So it's 2-2. It's split by the Board of Selectmen. Mr. Knox is not present tonight. He's away. So as far as requires a majority to move, unless Attorney Rubin gives us any further advice. So I do wish the Board of Health the best in the implementation. And if there's anything that the Select Board can do to help in implementation, please do reach out. We are one community and we do need to work together. So I do appreciate all the time that you know, everybody that supported all of us has put forward. It looks like you guys are going to have to do you're going to have to go out and advertise this in order to use, what is it, section 31, chapter 114, section 31 would have to be the order instead of using 104. So if there's not anything else, I would accept a motion to adjourn from Select Board.
So moved.
Second.
Thank you.
Moved by Mr. Nordhaus, seconded by Ms. Napoli. Roll call vote. Mr. Nordhaus.
Yes.
Mrs. Glavy.
Aye.
Ms. Napoli.
Aye.
And Chuck DeCosta's aye. Again, thank you very much, Attorney Rubin, Board of Health, Anthony, Joe, all those involved. Janet, thanks for being the timer. And thank you for everybody that was involved.
Thank you all.
Good night.
Thank you, guys.
Thank you all.
So Anthony, my understanding is that the Board of Health is going to continue its meeting?
Yes.
So without the select board's support, we are going to draft a regulation, correct?
Correct.
Point of order, Madam Chair. We still have a number of select board member, or at least we have one select board member here as a panelist. I believe they've adjourned their meeting.
Janet, you can just put me as a spectator. Thank you.
Thanks, Chuck. Okay, Anthony, can you give us a little guidance about what we do next? Do we use the verbiage that Alexandra has edited for us, or do we need to take a, or have we voted and now it's a regulation?
So Alex, you want to just guide them through the right way that they would go through it on their own?
Sure. So the authority for the regulation is a little bit different than the joint. What I can do is I can pull up the regulation draft, and we can either, there was good conversation tonight and good public comment. I can just port over the changes that were made to the order and put it into the regulation. Or you could essentially start fresh. It's up to you.
Any recommendations from the board?
Yeah, I think we ought to just, we already have been through this exercise in different forms. I think one way or another, this is just one step in the process of over a year. So I would suggest that we take what we've got and make the necessary changes to make it clear that this is a Board of Health initiative.
So what you can do is you can do a motion that allows the chair to work with me and then sign a regulation. Once I do Scrivener's updates to it, that changes, just the authority to make it a regulation. One thing that will change is that the effective date, it's going to be effective upon publication in a newspaper of general circulation in the town. So you're going to have to think about the publication schedule. But you can motion that we can take the text of the joint order and turn it into a regulation that the chair of the board can work with me on finalizing, and then she can sign on the board's behalf. Or alternatively, we can all just hold on a minute while I make the changes to the regulation draft, and we can do it now.
Let's do that. I'd rather have the board involved.
Okay. All right. So just give me a couple of minutes.
Madam Chair, while she's working on that, this is in fact a new public hearing. Do we need to go through our standard public hearing process of opening up for public comment, discussion, and that piece? Well, obviously we've had plenty of discussion tonight. This is in fact a new public hearing for technically a different matter, even though it's covering the same material. This is just a procedural question, but this is a new public hearing, separate from the joint meeting with the select board. Do we need to open this up as a new public hearing?
Yep. Anthony, is that correct? For Janet?
Personally, I don't think so. Alex, unless you think differently, I think that unless somebody has something new to offer, I think you spent a lot of time on this tonight. That's just my opinion.
I also note that the hearing session was never officially closed by both boards, so technically it's been open. So we should probably close the participation component.
I think we did close the participation when Janet said that there were people with their hands raised. We told them that we were done with comments,
Oh.
public comments.
Okay, so you did close it. Okay.
Just wanted to make sure, since they were posted on the same agenda, but it's two different hearings, I just want to make sure we are checking all our boxes and making sure this is in peace. While Alex continues to work on that, I will be honest, the select board brought forward some really important pieces of our mitigation strategy that certainly are within, I'm not sure, certainly within their scope, choosing to, and Anthony's choosing to close down public access, go into Zoom meetings. I think currently, again, this is not, based on my normal level of research, I believe the select board is the only board now that's meeting in person without Zoom access. So that's something certainly the board of selectmen could take on their own.
Ed's shaking his head.
The planning board's meeting, and just a point of clarification, Dan, nowhere on tonight's agenda, I just looked it over, it doesn't say that this is a hearing.
Right.
There's joint meeting with, under this, it would be COVID-19 update mitigation strategy, review and discuss a proposed indoor facial covering mandate / regulation by the Board of Health and possible vote if necessary. So there's no hearing.
Okay, cool, thank you.
You're welcome.
Again, while Alex is working, certainly just for a board discussion piece, are there any other recommendations we may like to make as a board or recommend the?
Uh-oh. Dan just got frozen.
Yeah. You made him frozen.
To the board of selectmen.
Oh, he's back.
But you can, I hear Gina talking to me, so he's hearing it. I'm not sure what you heard. So the piece that certainly shared to cost brought forward a number of other mitigation strategies, which again, all of them are valid and should be looked at regarding, Zoom meetings for boards, town hall access, some of those other pieces that, certainly should be on our list of options and tools in our toolbox. I'm not sure if they need to come from Board of Health action. I think for a number of those things, they can come from Board of Selectmen choices. So his discussion of these are things that should be done, I think, I'm not positive, are certainly things that are within the scope of the Board of Selectmen, or the Select Board, to be able to address a number of those. I'm not sure if we need to make recommendations to them on that behalf, or again, since the chair had those ideas already, that's not something that they would be able to recognize that they could take action on independently. I'm not sure if that's a discussion point for the board as we look at mitigation strategies that we could offer up.
All I know is in the past, in the most recent past, the select board has basically sought advice, I believe, from Jim and others about the best process and then acted accordingly. And I think that's probably their custom, and I think that there's no reason to believe that they would follow any other course.
Okay, I shared my screen so we can go through the regulation. Let me know when you're ready to scroll up.
I'm good.
Yep.
Ready.
Gino, are you with us?
Yep. So far, so good.
So number 3, we had a lot of did you already change them?
Yep.
Oh, okay. All right. I'm reading from my paper, so.
So far, so good.
I'm okay.
Okay.
I'm all set.
I'm all set.
Can we change the and or to an and, please?
I think the and/or accomplishes, since I believe we've been instructed that the and/or is equivalent to or, and that the and/or may be more graphic and more, shall we say, informative to the general public. And that was the reason for sticking and/or.
That's
And
right.
maybe I misread it or misunderstood, but please explain. You know, if you feel it's Kevin or anyone else. I mean, I'm used to seeing or and, but that's a different world. And the variant shall, never mind.
I just think the and has more teeth and means more, but I do understand the visualization of the and or within the document. So I'll leave that up to the board to decide.
Alexander, do you have any more comments for that at all?
Legally and or is an or. So it's entirely up to you whether you want to make it an and or if you want to leave it optically and or and have it functionally be an or.
I mean, personally, I prefer for it to be concrete and be an and, but that's just.
And again, it's still optimal, essentially optional criteria. So
I'm okay with and or.
Okay.
Me too.
Yeah, the rest of it looks good.
So I want to just make it highlight this. It becomes effective upon publication. We don't know the publication date. We don't know what the schedule is. So right now that's going to be blank. I can say it becomes effective upon publication in the Lowell Sun, period. Or I can say, let's say it gets published, and this was one of the things that was discussed during the previous session. Let's say it can get published, I don't know, Thursday. If you still want to give businesses and residents time to prepare for this, we can say that it won't go into effect until Monday, September 6th, which was the date that was previously discussed. So perhaps there should be discussion about the effective date.
Does Janet know the publication schedule?
I very seldom use the Lowell Sun. I think that we could probably get it in Thursday or Friday.
Or it could be a different newspaper. It needs to be a newspaper of, let me get the exact verbiage. I believe it's general circulation in the town.
Yeah, the Eagle is a week out, so the Lowell Sun would be our soonest option. And typically it's a few days, but I'll have to check in the morning.
I think the key thing here is to the publication should be the one of general circulation and the one that's as soon as possible.
I think we're going to roll this out with the opening of schools, which is Thursday. But.
Right. I think the earlier is the better.
So we can say it becomes effective upon publication.
Okay.
Okay.
we better, but someone may ask, what is that date? Okay.
I don't know what that date is.
And since we don't know the date is, so it's basically, I guess this cannot be filled in or completed until we know the date, if we have in there a date, a blank for a date.
Can I
So
jump
I-
in?
I would
Can I-
suggest-
can I jump in for a second? Joe, if we publish it, we get this in tomorrow, if we request it, it's the next day, is that correct?
If we sent this off to Lowell Sun tomorrow, realistically, it would probably be Thursday. They usually can't do it the next day, but 2 days later is what we have been able to get things in.
That's good.
Okay. How's that?
Works for me.
Great.
So Janet, you can Joe can give you the contact information of the Lowell Sun, and you can put this in the legal section, legal notice section.
Janet, would you
Well,
let?
are we saying that it's effective as soon as publication, or are you saying that it's effective on Monday, as you had previously stated when the select board was present?
Yeah, what does it say up top?
It doesn't say anything up top.
It's waiting for you to make a decision.
Okay.
I kept it on the bottom.
It can't be effective until it's published, so we can't pick a date. I think just leaving it blank, it's either upon publication, or we could pick, 2 days or 1 day after publication as that public notice and preparation window if we wanted to. But I think picking a hard day, if we pick Monday and the Lowell Sun says, hey, sorry, we can't get it in until Tuesday, unlikely, but.
I don't think that's going to be the case. We should be able to get it this week.
May want to just allow some time for staff, Jim Gareffi and Janet, to have this sent out to the businesses. So maybe you pick Friday or Saturday for the date, like originally was talked about a couple hours ago.
Yep. I thought that's where we're heading. Give the Lowell Sun a chance to do it and basically get.
Just pick a date.
Yep.
Pick a day when you want it, regardless of the publication. It's legal once it's been public with the publication date, but as far as to let people know, pick a date.
Sunday or Monday?
Monday sounds good for me.
Yep, Monday's great.
Okay, September 6th.
Midnight on whatever that date is.
9/6.
Okay.
Yep. I'll make is this point to make a motion, or are we, since we got the date?
Anthony, do we make a motion to accept the regulation the way it's, oh, go ahead, Dan.
Sorry, I just realized Monday the 6th is?
Labor
Oh,
Day.
it's a holiday. It's Labor Day. Yeah, that's right, Dan. But if you want to make it the 7th?
Sure.
Midnight, September 7th?
Unless you want to bump it up to Friday before. I mean, it's up to you.
Unless you want to give the businesses the one last hurrah.
Yeah.
And bump those numbers up a little bit higher before we go.
So now do we make a motion, Anthony?
Sure, yes.
Okay. So entertain a motion from the Board of Health to accept the regulations as they're written.
Make a motion to accept the regulation as written.
A second.
And a roll call. Kevin Baker,
Baker, yes.
Gina Fratelloni,
Gino, yes.
Dan Kane,
Dan Kane, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Lisa Flanagan, yes. All right.
think the next motion is to adjourn.
Make up,
Motion to adjourn.
thank you.
Second.
All right, and the roll call, Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Yes.
Dan Kane,
Dan Kane, yes.
Mike Zeldin,
Mike Zeldin, with thanks to all those who attended on panel or not.
meeting, I know it's kind of out of order, but our regular scheduled meeting. Janet?
Is not this Wednesday. I think it's next Wednesday. Let me look fast. The 8th, September 8th.
Okay. All right, and Lisa Flanagan, yes. Did I do that?
You did.
Okay, so we will